Так, як тут що? По звуку. Ми ще ж не почали трансляцію?
Have we already started broadcasting?
Так, нормально? Чутно? Добре?
Can you hear me? Is everything fine?
Шановні учасники Національної
Dear participants of the National Scientific and Practical Conference on launch of the project Reach 95, Re-envisioning excellence and accessibility in clinic-based HIV services. Dear colleagues, dear partners, dear friends. On behalf of International Organization Pact, me, Svetlana Leontieva, Chief of Party, Director of Reach 95, welcome you here in this very nice hall and everybody who is joined online who can see us due to National TV Hub platform. And I'd like to say that there are a lot of us currently. The conference on launching Reach 95 registered, can you imagine, 2,465 participants. So welcome you on behalf of International Organization Pact, our dear colleagues who joined us online, because our conference is going to be in hybrid format. At the beginning, I'd like to express our gratitude to our defenders who keep the line, who defend us and fight for independence of Ukraine, and they enable us to have this conference on launching the project Reach 95 in this very nice hall together with our dear partners, donors, colleagues, healthcare workers, to great respect and gratitude to our defenders and the medical workers who keep on working during the full-scale Russian invasion of Ukraine. Thank you so much. And the new project, which is the project of changes, and which already engaged 268 healthcare facilities of 16 Ukrainian regions. This project will be the project of changes. At the beginning, I'd like also to thank a lot to our major donor. It is the US President's emergency plan for AIDS relief and the United States Agency for Financial Development, USAID, for the sustainable support to Ukraine for many, many years. And I would kindly ask our colleagues to join the panel. Milan Pavlovich, who is the Deputy Director of the USAID Office in Ukraine. We also have the General Director of the State Enterprise of Ukraine, Public Health Center of Ukraine, Mikhailo Rosada, and also Ms. Katerina Hamazina, who is the head of PAS Ukraine Country Office. please come to the Presidium. And also, we have two more our partners and colleagues. They are present online. And one thing to add, our practical and scientific national conference is registered with the Center of Testing of the Ministry of Health of Ukraine by the provider of our of continuous professional development, our long time partner, National TB Hub. This capability has been developed with the support of Pact under a number of projects supported by USAID. Mr. Milan Pavlovich, please take your seat in Presidium, supported by our applause. Just want to say that it is the National TB Hub. It has been cooperating with us for many years under different projects funded by USAID. And it's important that all the participants, healthcare or medical workers who registered for this National Practical Conference, and in the second day of the conference will pass the test successfully. By the way, it will include 10 questions on the topic of our conference. And in case if 70% of questions, that is seven questions out of 10, should be replied in proper way, the medical workers would receive the certificate of participating in a national and practical conference with 20 scores to their continuous professional education program. So our project to reach 95 is definitely the project of changes, and without a strong political will of the Ministry of Health of Ukraine, the Public Health Center of Ukraine, its launch and its implementation in Ukrainian healthcare facilities is impossible. And now we welcome Mr. Oleksiy Dalinenko, who joined us online,
Департаменту громадського
the
здоров'я
Public Health Department of the Ministry of Health of Ukraine. Over to the screen. Good morning, everybody. Can you hear? Can you see me? Yes, we can see and hear you well. Thank you, Ms. Svetlana, for introduction. First of all, sorry for not joining you physically. In addition, we are having blackout right now, so I joined you via telephone. So yes, thank you so much. Ukrainians are resilient in any situation. Dear participants, I welcome at the conference, and it's my great honor to represent the Ministry of Health of Ukraine at the conference devoted to the launch of the project Reach 95, Re-envisioning Excellence Accessibility in Clinic-based HIV Services in Ukraine. This conference proves the need for further fighting HIV. Our country has reached significant successes in implementation of the national strategy, and the UN strategy 95-95-95. We, like all the people with the will, know their status, receive their retrovirus therapy, and those who receive it reach the suppression. These objectives are not the figures, they represent the saved lives, the saved families and communities. Eventually, our the project that we have been working on for a long time implementation action plan to implement the strategy of fighting VIL and hepatitis was approved by the Cabinet of Ministers on the 18th of June. In the soon we'll draft the relevant bylaws, and all the actions will be implemented. Actually, the way to achieving the targets we set is not simple. According to the recent data, almost 80% of people living with HIV in Ukraine do know about their status, but however, it is not the significant achievement. It demonstrates the gap we have to cover. The war in Ukraine exaggerates the challenges because it causes significant migration and of population, which makes getting healthcare services more difficult. Healthcare facilities that are able to provide HIV-related services are subject to shelling and destroyment. But despite those challenges, our commitment is unwavering. We have implemented innovative approaches in testing for HIV, even in the most remote areas, and those areas that suffered impacted by the war. We have we have implemented the new ways of testing and more quick one. Integrating HIV services in primary healthcare service and medical healthcare services provided by specialized clinics, we simplified providing those services to people. In terms of educational institutions, we created more supportive environment for people living with HIV, both in the society and in universities. So cooperation is the basis of our strategy. By cooperating with the international, with global health organization, we have implemented and still implementing new innovative ways. At the same time, we realize that we still face a lot of challenges related to damaged facilities, laboratory equipment, professional burnout of our staff, migration of both patients and staff, verification of data and control, quality of services, and much more, which cannot, of course, impacts the quality of service and the quality of data and efficiency of this process. I'd like to call everybody to consolidate our efforts and consolidate to the global objective, to reaching global objectives, both at national level and local level, to decrease stigma and discrimination, development healthcare facilities capabilities in terms of HIV-related services. At the same time, with the support of the government due to the innovative decisions, thanks to our international partners and patient-oriented approach, we will definitely reach the objectives. Let this conference be the platform for sharing knowledge, strengthening partnership, and moving forward in fighting HIV and AIDS in Ukraine. And I'd like to wish all the participants of the conference who joined both offline and online fruitful work and reaching the planned objectives during these 2 days and in your future work. Thank you very much for your attention. Thank you. Thank you so much, Alexei. And like to reiterate that the beneficiary of Reach 95 project supported by PEPFAR and USAID is the Minister of Health of Ukraine, and the recipient of the project is the state-owned enterprise, Public Health Center of Ukraine, and also regional health center department of our civil and military administration of 16 Ukrainian regions. So I would kindly invite Mr. Mikhail Rosada, Director General, Public Health Center of Ukraine, for welcoming speech. Thank you. Thank you, Svetlana. I'm not going to repeat the statistics on HIV. We still have increase in number. I'd like to draw the attention of those who are present here to the advances made by medical sciences. In 80s of 20th century, we said that HIV cannot be treated, but today we say that the therapy, if it is in timely treated, can be really efficient, and people can live in comfortable way and be a free member of the society. And it's really a very good step forward, and it gives us hope for eradicating this epidemics. So currently the challenge is diagnostic and testing of those who don't know their status. So the Russian aggression has damaged all the system. Many people, even those who they know their status, they cannot get access to therapy. I'm talking about the occupied territory. We can get a lot of information about the situation in the occupied territory. Me, personally, I'm epidemiologist. I do realize how important it is to test and identify this infection in a timely manner. That's why REACH-95 is a very useful launch of a very important element in fighting HIV. So I just wanted to add that on the 18th of June, the government of Ukraine has approved the operational plan.
26 років, але про це мої колеги будуть говорити.
Actions against hepatitis and HIV till 2026. I think my colleagues will provide more detailed information. I would like to add that me personally and the staff of our public health center, we are a reliable partner in fighting HIV and other socially important diseases, and in your actions you can rely on me and rely on our support. Thank you for your.
Thank you, Mikhaila. Thank you personally to the entire team of Public Health Center for the political support, for multi-year support of our organization, of international Pact organization. We are working closely implementing this project because the objective of REACH-95 is helping Ukraine, helping the Ministry of Health of Ukraine and the Public Health Center, and also our healthcare facilities to help all of us approach the situation where we control the HIV epidemic and where we reach the 395s that are key also in the name of our project, and that must be reached before 2030. We are working together, and together we can achieve that. All change starts with us. However, any international project, technical assistance project, so all of them are registered by the cabinet of Ukraine, and our project REACH-95 is registered as an international technical assistance project and support for the Ukrainian government from the American government. And we are so grateful to our key donor, USAID, for multi-years support and adherence, supporting Ukraine in developing our healthcare sector, and also fighting the HIV epidemics in Ukraine and global. And we are happy to welcome here on the board Mr. Milan Pavlovich, who recently joined the Ukrainian cohort or team. And we are so happy to welcome you. Now he is Deputy Director of USAID Ukraine Mission. And now the floor is yours. You're welcome. I am Milan Pavlovich. I am Deputy USAID Ukraine Director. And I'm happy to be with you today. And I'm still learning, studying Ukrainian, so I'm switching to English.
And equitable HIV services within the public health care system. Under the guidance of these institutions, Ukraine has made large-scale improvements in HIV testing and treatment. As part of its HIV control efforts in Ukraine, the ministry has institutionalized person-centered HIV care, which takes into account the individual needs of patients, using tools such as mobile healthcare and telemedicine to reach communities in need, no matter where they are. USAID's Reach 95 activity will expand these efforts by working in close cooperation with and in support of the Ministry of Health, its Center of Public Health, regional healthcare administrations, as well as more than 250 public health care facilities in 16 regions across Ukraine. The top priority is testing. Knowledge of HIV positivity is the first step toward critical linkage to life-saving treatment. Reliable delivery of high-quality HIV prevention and treatment services is crucial, now more than ever. Over 2 years of bombings and attacks have damaged or destroyed many healthcare facilities and have caused wide-scale healthcare delivery disruptions in Ukraine. Russia's full-scale invasion continues to target and attack hospitals, clinics, and other health infrastructure, leaving the health sector increasingly vulnerable. The Reach 95 project will bolster and expand critical health services, with a key focus on expanding access to equal and quality HIV care across public health care facilities in Ukraine. This also includes optimizing HIV case finding to better link those in need to prevention and care services. Decentralization of these services is also essential, so that they can be provided as close to communities as possible and reach emerging risk groups due to war. To best advance these goals, Reach 95 will expand and scale up service delivery innovations and best practices, including self-testing and index testing, as well as transitioning successful health initiatives to the Ministry of Health, with the ultimate goal of supporting viable HIV programming at the local level. REACH 95 also aims to remove social barriers and improve access by promoting rights-based approaches to care and ensuring that people living with HIV can live their lives free from stigma and discrimination. REACH 95 emphasizes the need for person-centered care, healthcare provider counseling training, and support teams consisting of social workers and peers to ensure that HIV services are truly accessible. The person-centered care approach is about tailoring care to the individual person who needs it. It means taking the time to understand the constraints on their ability to come to a clinic or to pick up their medicine. Taking the time to understand if they have a support system to rely on or if they need someone to talk to. Above all, person-centered care measures success, not just by the number of people reached, but by the impact on each individual life. Although we are here to acknowledge all of the incredible goals of REACH 95 and celebrate its official launch today, the project team has been hard at work already. From October 2023 to January 2024, the REACH 95 team was on the road, conducting visits to 16 regions and 62 healthcare facilities to assess HIV service delivery capacity. In this first year alone, the project will also develop a strategy on stigma reduction, train 500 healthcare workers in patient management, and conduct over 150,000 HIV tests. With this impressive start, I am excited to watch the growth of this PEPFAR-funded activity as it lives up to its name of Re-envisioning excellence and accessibility, taking up the mantle of revolutionizing and expanding HIV awareness, prevention, testing, and linkage to treatment, all of which are critical for improving the health and well-being of all Ukrainians. Thank you to all in attendance today for joining us as we work towards an HIV-free generation by 2030. And finally, I would like to say I am so happy to be back in Ukraine. I lived here and I worked for USAID Ukraine from 2008 to 2012. I was just telling my colleague in the car that back in 2009, we had a visitor from Washington, D.C., a very senior level visitor from USAID. And back then, I helped organize site visits for him. One of the things that we saw in Ukraine, in Kyiv at that time, was a mobile clinic for testing. And I'm so delighted that we are launching this program and that we can build on what we've already done over the past years. Thank you so much. Дякую.
Welcome back to Ukraine, dear Dr. Milan. And я хочу сказати, що надзвичайно важливо.
And I'd like to say that it is so important that we have USAID PEPFAR support. And I would also like to emphasize that the leadership and office of the regional mission of USAID led by Robin Martz. So the healthcare office continues cooperating with a lot of organizations that are implementing projects to overcome socially hazardous diseases. In particular, thank you for your support. At least till July 2028, we will keep going. And now I'd like to pass the floor online to Dr. Kim Green, Director of Primary Healthcare Programs of our international organization, Pact. And I hope that Kim is with us now. So we are ready to pass the floor for the welcome address for the Ukrainian audience. You're welcome.
Thank you so much, my dear Svetlana. So my dear greetings to Dr. Janlenko, Dr. Rosada, Dr. Pavlovic. Welcome back to Ukraine, Dr. Gamazina, and colleagues. I'm profoundly honored to join today on behalf of Path's Global Primary Healthcare Program to celebrate the national launch of the impactful Reach 95 project. Additionally, I want to extend my gratitude to all the attendees here today. As many of you know, Path has worked in Ukraine for over 3 decades, and we are immensely proud of our longstanding and impactful partnerships with the Ministry of Health of Ukraine and the Ministry of Health's Center of Public Health, alongside with the regional healthcare administrations, with many amazing community-based organizations, with our longstanding partnership with USAID, and with so many other stakeholders we work with. These partnerships are in evidence today as we come together with the shared goal of accelerating Ukraine's efforts to achieve HIV epidemic control by 2030. Within the context of reforms within primary healthcare and with health service delivery overall, but really importantly, recognizing in the context of not only recovering from COVID-19 impacts, but also experiencing the full-scale Russian invasion and the ongoing impacts of the war. I so wish that I could be with you today. I've had the honor of visiting and seeing so many innovative approaches to HIV, to TB, in partnership with primary healthcare, in partnership with the community, in the civil sector and the penal sector before COVID and before the war, and have continued partnering with Dr. Gamazina, with Svetlana, with the team throughout until now, and have been awed by such a resilient, dynamic, and responsive team and partners. So I want to really recognize how hard all of you work, have been working, and continue to work. As already mentioned by Dr. Pavlovic, all of the work that's already happened before the launch of this project. So now, as we turn to the launch today, we have an opportunity to discuss what we've learned from the assessments and the facilities in the different regions, really understanding how to contextualize, as also Dr. Pavlovic spoke to, is the person-centered approach. What are we learning in terms of how to adapt and titrate approaches? So today, tomorrow, this is such an exciting agenda to be able to talk about additional innovations, additional approaches where HIV services can continue to effectively reach people who need them within the context of Ukraine, and thinking also then about how to integrate HIV services within primary healthcare, thinking about long-term sustainability at the same time. So Path has been thinking about these issues also for a long time. We've been looking at the integrative role of HIV, understanding that people affected by living with HIV have multiple healthcare needs over their life course, and how to best integrate, bring those services together so that they are as accessible and as responsive to individuals and communities as possible. So we've been doing this since 2015, probably even before then. So have quite a lot of rich experience to bring forward on the many advantages, but also some of the challenges that can be anticipated and how they can be addressed over time towards integration. So for Path, we have a global primary healthcare strategy. It focuses on 3 objectives. Number 1, advancing tailored primary healthcare services that meet individual and community care needs. Number 2, catalyzing optimally resourced primary healthcare systems. And 3, strengthening primary healthcare capacity to resiliently respond to health threats. And I think these 3 objectives for Path align so well with Ukraine Ministry of Health's direction towards primary healthcare and also the Reach 95 project. And so we look forward to bringing our aligned thinking together to further advance Reach 95. So with all of the work that's already happened by the Reach 95 team, they've been able to bring forward ideas around customized HIV service delivery interventions that not only meet the unique needs of individuals, but also of each oblast facility, and include ways to decentralize PrEP, which is very exciting, integrated care models, and new access points for HIV self-testing, multi-testing, and nationally certified education courses and training. And there'll be more discussion on that today and tomorrow. So these results from the assessments that have been done will support ensuring that public health facilities will be optimally resourced with the skills, supplies, and tools that are needed to provide HIV services under the program of medical guarantees. And finally, that the Reach 95 approach is building the resilience of Ukraine's public health care facilities to provide high-quality services in the context of war and pandemic recovery. So the Reach 95 approach is very much driven by the data collected through our assessment and past longstanding work in HIV in Ukraine. However, it's also driven by overarching catalytic principles, inclusive and rights-based approaches to combat stigma, violence, and gender-based related barriers to HIV services, close coordination with all partners and existing initiatives, continuous quality improvement to routinely assess and constantly improve the quality of care, really based on the feedback of people living with HIV, of communities and people affected by HIV. And most importantly, effective transition and institutionalization of successful approaches to ensure sustainability. To this end, we are also delighted to be working with our many partners under Reach 95, and I'd like to mention just a few of them. Prevention Access Campaign, which is led by people living with HIV and really embracing the U=U messaging, as well as PrEP. Yale University, bringing their technical expertise in advanced HIV disease, Public Movement for Faith, Hope, Love, and so many others. Thank you for being our partners. So finally, we are proud to support and stand with Ukraine to strengthen resilient integrated HIV services as part of primary healthcare and to effectively reach 95-95-95 goals. I wish victory to Ukraine, and I thank you so much.
Thank you so much, dear Kim. Я хочу сказати, що
And I'd like to say that it seems that we are just launching Reach 95 with this two-day conference. However, at this conference, we are already going to report on our first success implementing Reach 95, in particular, success in Chernihiv region, in the field of decentralization of services, full package of HIV services at the primary care level, and implementing at primary care centers in Chernihiv region was started a year before it was planned, actually, due to political support and the initiative, proactive approach of the department and healthcare facilities. So we already have the first achievements that even at the launch ceremony can be presented. Thank you.
I'm giving floor to Katerina Hamazina. She is the leader of Pact Ukraine Country Office and does have institutional memory. So of those 30 years that have been already mentioned, Ms. Katerina, over to you. Thank you very much. Svetlana, not 30, only 29. I'm sorry. I'm really happy to see you all, your old friends and new colleagues who came here and who joined online. And as a professor, I can remember this enormous number of participants in the conference. Thank you for your interest and for the communication capacities to arrange the conferences like. It's really a challenge to me to say this welcoming speech because everything that I plan has been already pronounced before me. So our organization is the global profit organization operating in more than 90 countries over the world for more than 50 years and in Ukraine for 30 years. And we have cooperated with many of you under some other projects. So the mission of our organization is achieving equal possibilities for people based on partnership and possibilities. Thank you for your partnership, for your support that we had a chance that we felt while implementing the project. Without you, no project could be implementable. Today, a lot of words have been already said in terms of gratitude, and I still express my gratitude to USAID and PEPFAR, but first of all to the American people for supporting the healthcare projects in Ukraine that has been provided for all this year and for supporting Ukraine overall support. Those projects helped us to change the situation dramatically. Here we can see participants who were one of the pioneers, and they can evidence what was the situation 30 years ago. Dr. Sada mentioned that it was the plague of 20th century. 20 years ago, it was a virus therapy, but there was a significant steer and etc. You know all that. Providing support was very decentralized and very individual. But we have done a lot. The progress is enormous. My personal opinion, you can find it. It's unofficial, unofficial opinion. HIV has not considered to be infectious and very much dangerous disease. People can live with this disease, but we should help those people. When the person addresses the doctor, he or she could get the comprehensive package of services. When we all can get ill, and we all know that it is really not very much comfortable to go from one doctor to another. How exhausting is that? And it doesn't actually ensure the results of treatment. There was a joke. In order to get treatment, you should be a very healthy person. So with compared to HIV, so remember back at that time, when the question was asked to one, why the family doctor, the therapist cannot provide HIV testing or treatment. The reply was, no, the family doctor can provide all other services like oncology, for example, but not HIV. And such approach decreases the efficiency. We do have very good results, but anyway, such approach decreased the results of program approach and also contributed to stigmatization because HIV centers are separate from other healthcare facilities. So yes, it was really an obstacle for implementing the programmatic approach to HIV control, so that people living as HIV live normal life. Yes, they take pills every day, but they do have their life as normal people. That is our objective. We say that the treatment or providing service should be patient-oriented. What does it mean? It should be integrated both at the primary health care facility, also integrated in the community-based. The communities, the role of communities is really enormous, and also at other levels of providing healthcare services. I would like to wish the project that after 5 years of its implementation, so that there should be even no question about implementing patient-oriented HIV support. That it should be a norm and it should be our routine practice, and not only for HIV infectious. So the agenda is very intensive, and the project is very intensive. Everybody is looking forward for very intensive work, but wish you enjoy being here, enjoy socializing, and looking forward to our fruitful common activities. Thank you, Katerina. So the welcoming remarks are over, and we really appreciate the members of our honorable presidium. Please take your seats in the hall. And now I would kindly ask my colleagues from International Organization Pact to come to the scene, because we are now going to launch the Reach 95 project. Dear colleagues from Path, please come here. Please join Katerina. To dear colleagues from International Organization Path, we are waiting for you. Please come to the scene. We still, I can see Konstantin is from Path. Who is, who else? Людмила Стафлю. Yes, Slava, please come. Because now, so dear colleagues, it's a surprise. Svetlana, the project director, leader, she loves surprises. So we, being the Path team, jointly with the audience present here, and jointly with all the registered participants, and you remember that there are 2,465 of them were registered at the beginning of today. Remember, only today that you can officially register yourself on National TB Hub for participating in this conference. Tomorrow, registration will be impossible, and you will not be able to fill in the final questionnaire and get the certificate with 20 scores for continuous professional development. So on the scene and on our screens, we will see the unique start button for Reach 95, and it's a surprise as well, because we are going to count from 5 to 1 altogether. So let's launch online live broadcasting. 3, 2, 1. So the project is launched. Open. Thank you. We'll work together for the whole 5 years. Thank you, colleagues. Thank you. So, and I kindly ask to share my presentation. I'm the chief of party and head of Reach 95 project, and I will outline the objectives and key activities of the project. So, next slide. Or I can have this switcher, special device. Yes, it works. Katerina Hamazina already mentioned that our organization is international, non-for-profit, and has been working since 1997, and to improve the health of children, women, and improves access to high-quality healthcare services. Yeah, did. This year we celebrate 30 years of activities, operations of our organization in Ukraine, but overall our international organization operates in more than 70 countries globally. And I have been working for more than 20 years in Pact, and it is one of our projects in line of projects which we realize together with our very good international team. I already mentioned that the Ministry of Health is the beneficiary of the project, and the Public Health Center and the
Фінансується проект
health care departments of 16 regions will be the recipients of the project. The project is funded by
народного
with the
розвитку.
support of
Тому
the
ви
US President's Emergency Plan
в
for
банерах на
HIV
наших презентаціях
through the United States Agency for International
лого
Development.
нашої міжнародної організації ПАС.
USAID
Також наш проєкт
and
впроваджує
Pact. And our project is going to be implemented in partnership with two international companies. One of them is Prevention Access Campaign, Pact, and Yale University, and the public organization, Public Movement Faith Hope Love. This
проєкт
is our
разом з урядом, центральними, регіональними державними
which
органами.
will be engaged in implementation of the project together with the national government, regional authorities. And remember that it is for the first year, each of
До реалізації.
have approved 268 healthcare facilities in 16 Ukrainian regions will be participating in the project. These 16 regions include 15 regions that have been traditionally supported through PEPFAR USAID, where they try to control the HIV/AIDS epidemic. But during the war, we have a lot of IDPs who left the initial place of living where the HIV projects were initially have been implemented. So our project covers also additional 4 regions where the morbidity of HIV was quite low, but today they received a lot of ADPs. It's Zakarpatsia, Ivano-Frankivsk, Zhytomyr, and Lviv region. Our project will continue till the 21st of July 2028, and the healthcare facilities who are participating in the project now, as of now, they represent all 3 levels, including the primary, secondary, and tertiary levels. In terms of the target groups of the project, they include the general population who comes to get medical services under the national program. But there are also priority groups which could include the key and vulnerable HIV groups, including hidden or former key groups. So our project will be focused on search and identifying new HIV cases among the priority groups. And also, like to say that in the context of the full-scale Russian invasion, our project will cover the IDPs, those who were sexually abused, war veterans, etc. In terms of strategical approach for the project, it was very important from the very beginning when international organization Path was considering, was designing the approach. We realized that the project should be based on a common understanding of the following approach. If HIV testing services are quality, uh, safe, free of stigma and discrimination, it's clear that people living with HIV and with HIV risk, they will get those services in healthcare facilities. And if the healthcare workers provide services both related to prophylaxis and treatment of HIV, it's clear that more people will get timely treating, would get low burden, and would prevent HIV dissemination. And in that case, you can state that we approach to control over HIV epidemics by 2030. These are the key strategic approach we are going to implement. The key objective of the project is to make accessible high quality HIV services in public healthcare facilities of Ukraine and in strengthening the efforts of the government to by 2030. We have three global targets. The first one is focused on improving quality of the HIV testing in public healthcare facility for more efficient identifying new cases and prophylaxis of flu. And the activity under the first target includes implementation of different models on HIV testing. They include initiated by healthcare worker. It's safe and ethical index testing. It's self-testing based on a health care facility, which includes installation of self-testing for saliva sampling using postal services, etc. Under our project, we identify people with progress in HIV infection for timely treatment. We are talking about an improvement of access to service on prophylaxis. And what is also very much important is the training of our healthcare staff in our healthcare facilities and our training, which includes the thematic in training, under which 95 is registered with the Ministry of Health of Ukraine with the relevant certificates and scores of continuous professional development. In terms of the second global target, it's about decrease of stigma and discrimination of people living with HIV by healthcare workers and implementation of human operated approaches. Under the second task, we are going to implement the approaches which are based on human rights. We are going to have the researches of stigma index. We will also implement supervision and clinical mentoring, multi-testing for HIV, hepatitis B and C, and syphilis. And what is also important is to increase public awareness of HIV risk That's why we have created the online website section. We disseminate video materials and printed materials. And one more important activity is support to external control over the quality of testing. So, and this
So here we provide capacity to provide full range of services for prevention and treatment of HIV. In the framework of the third objective, we have already picked up 18 primary care centers in 3 regions of Ukraine. This is Chernihiv Oblast, Mykolaiv, and Dnipropetrovsk Oblast. And there they receive technical support in the framework of the first year of Reach 95 project to sign and provide a full package of HIV services under medical guarantees program. In the framework of the third objective that is aimed at decentralization of HIV services, we are going to equip and establish training rooms in selected facilities to implement any format of training. It may be online, offline, to implement supervisions, clinical mentorship, and so on and so forth. Also, in the framework of this objective, we advocate access to the information system, monitoring of socially hazardous diseases for our project facilities. We've started this activity. Tomorrow we will have 2 separate subgroups, and there we are going to discuss access to the information system for monitoring of socially hazardous diseases at one of those groups. We also provide technical support for improving the module for HIV testing, and we want to aspire to develop the process of data exchange for HIV testing with eHealth. Our project is registered by the Cabinet of Ukraine as an technical assistance project. That happened on the 8th of April 2024. We signed a memorandum of understanding between PAS and PHC. It happened back in December 2023, and as of now, with each department, healthcare department of regional health administrations, we also are signing a memorandum of cooperation to implement Reach 95, and we have already developed and submitted for signature 17 of such memoranda. And I can tell you that, well, now we are ready to express gratitude to those regions, to those departments of regional state administrations that have already signed the memorandum for cooperation. We are grateful to Poltava region, Chernihiv region, Kherson region, Transcarpathian, Lviv, Zhytomyr, Cherkasy regions, those who have already signed the memoranda of understanding of cooperation in the framework of Reach 95, and we are looking for further signed memoranda. And why is it important to have them signed? As I mentioned, every department of healthcare of regional state administrations are recipients of Reach 95. So in the registration card to register the international technical assistance, each department, healthcare department, will be registered, noted in the framework of cooperation within this project for us to transfer the tasks and the equipment, all the technical assistance to be provided in the framework of the project. I would also like to mention that in the framework of the project, we have a significant team of partners who coordinate this project at the national level and also at the regional level. We have 3 national coordinators, project coordinators, who are consultants of PAS international organization. We have 19 regional coordinators of the project, in 16 regions of Ukraine, 18 coordinators for monitoring and evaluation, and 18 coordinators for social work in 16 regions of Ukraine. So during our conference on launching the project, I'd like to give a round of applause to our team of coordinators in each region. And also, next year, we are going to start preparing another large team, and that's going to be a team of mentors, supervisors, and clinical mentors. So this clinical advisors, this is the team that implements at the regional level and coordinates implementation of REACH 95. So the team is going to grow, to expand. What's the role of our coordinators then? Let's look at the role of national coordinators, and I will ask Victoria Borisova. Well, she's not in the audience today, but she is our national coordinator for REACH 95, and it is Victoria Borisova. As now we see her, let's give her the round of applause. So Victoria is, please join me here. She is coordinating project activity at the national level with PHC. And it is Victoria who is coordinating activity of those 19 regional coordinators of our project, REACH 95, at the level of each region. So this is how our puzzle works. REACH 95, PHC, and our regional coordinators. That's the area of impact, the field of impact, and this is the scope of work for our national coordinator, Victoria Borisova. Thank you, Svetlana. And we also have regional project coordinators. I will not ask all of you to the scene. I will not make this surprise for you, but the role of regional coordinators of the project is very much about coordination of project activities at the regional level. And that's with departments of healthcare. And our regional project coordinators, they coordinate implementation of project activities at the level of project facilities and at the level of every region, where the healthcare departments, they have approved at least 12 facilities, and maximum is 24, 34. Dnipropetrovsk region is huge. So the regional coordinators, they coordinate implementation at the level of every region. And you remember I mentioned that there are coordinators for monitoring and evaluation. That's the cohort of our coordinators who, let's check, here we are, monitoring and evaluation. So they also coordinate activities at the level of every healthcare facility with the health department, with project facilities, and with REACH 95 in PAS. Our coordinators for social work, 18 of them, all of them are consultants of our partner organization. This is Live, Love, and Hope organization. So they refer clients for HIV services, for PrEP, for support, and for adherence. And they closely work with partner non-governmental organizations that implement support projects in every region. They also work directly with the physicians in project facilities to refer patients for ART sites. That's another piece of the puzzle. And the role of coordinators for social work also includes implementation of this kind of coordination between the physicians in project facilities and those who implement the projects for care and support, and people living with HIV and who are clients of our project. Key staff of the project, I would also like to introduce them. So I invite to the scene Tatiana Gaborets, who is Senior Advisor for HIV Services within Reach95, and Nina Roman, Senior Advisor for Monitoring and Evaluation and Strategic Information. On your flash drives, you have all of our contacts. So let's keep in touch because we still have a lot of years of project implementation ahead. And on behalf of our team, of Reach95 team, we would like to express our gratitude to you for your adherence to the controlling HIV epidemic. And we are so grateful. And we believe that with this team, after this range of evaluation visits to your region. So with such a team, we can definitely rely on that the objectives will be achieved, and Ukraine will be in the position to say that HIV epidemic is under control before 2030. But there is a lot of work ahead, so thank you for your cooperation. Thank you. Okay. Do you have any questions so far to me as the project director, project lead? Now, we would like to pass regards to all those who are now following us online via the YouTube channel of the national platform of the National Training Center. We also welcome you from here, from the audience. And now I invite to the Presidium our dear partners and colleagues from PHC under the Ministry of Health of Ukraine. Please join us. And now I'm passing the floor to Olga Vozdetska. She is Deputy Director General of Public Health Center of Ukraine. I also invite Larissa Hetman. Please give us a round of applause. And I now pass the floor to our dear partners from PHC. Hello, dear colleagues and dear partners. Svetlana, thank you for this introduction. That is very festive. I even feel a bit embarrassed. So I'm happy to see a lot of familiar faces, people who I have not seen for a long period of time here in the audience, and colleagues online. We are happy to welcome you and thank you for joining. So first we will say a couple of words of welcome and then we'll proceed with a presentation. Just to coordinate all of that, because there are a lot of exprompt situations. Okay, so first, words of gratitude. I am very grateful that the project has started, and we hope that this will be the project with which we will be implementing change together. During welcome address, we've heard about a lot of reflections, and it would really be good if at the end of the project we achieve the situation where every doctor recommends a test, so that it were a routine procedure like measuring the body temperature or blood pressure without any stigma or embarrassment by the doctor or the patient. And of course, there is still space for improvement, and with all of you, hopefully, we will do a lot in order to come closer to this goal, dream. Hello, dear colleagues, partners, and friends. Above all, I would like to congratulate all of us on the occasion of the official launch of the project, even though I have the impression that we've been working for like 2 years. together. And that's true, that the objectives are very ambitious and times are hard. This is when we have to implement these objectives. And of course, everybody here has this understanding, project implementing parties. We are doing everything possible to achieve these goals, because that's what we need at the level of the state, at every person's individual level. We're speaking about prevention, about people who are living with HIV. They need to have a chance for quality life, and we need to prevent new cases. So congratulations on this launch, and let's proceed with the agenda. Yes, but this was Larissa Hetman, and she is head of HIV Management and Response Department of PHC Ukraine, and our team, well, we've been working together actually since September 2023, because now we are basically completing the first year of implementing the project. We already have something to report on, so it's not just the launch event. I will also experiment a little bit. Let me add that Larissa Hetman, she is not only head of the department, she is national coordinator of HIV/AIDS program in Ukraine. And now we are ready to proceed with our presentations. Mikhailo trusts in us, and now he is living. So today, we have mentioned a lot. Mr. Danilenko mentioned in his welcome address, and Mikhailo Alexeyevich mentioned that. Mentioned the event that happened just recently. It was 2 days ago. So if we speak about implementation of the state strategy of Ukraine, I'm going to refer to that event and to the document that was adopted. And maybe you've seen this slide already, but anyway, let us emphasize that all of us are working together with the partners as a national institution to implement objectives of the strategy to counteract HIV infection, which was approved and developed for the period till 2030. There are 3 objectives of the strategy, and objective number 1 is actually about HIV. And since today we are speaking about HIV, not about hepatitis or TB, let's focus on that. So the first objective of the operative strategy is to reduce morbidity for HIV and reducing mortality of diseases conditioned by HIV, to prevent new cases, to improve the system for effective detection of new cases, and providing comprehensive and equitable access to treatment. So we know about the goals, 95, 95, 95. We have target values, but at the same time, these are the target values that were approved in the national strategy. And sometimes, so since the beginning of the war of Ukraine against, of the war of Russia against Ukraine, the system changed dramatically for provision of services and the approaches. With our partners, we can see that, well, 95% of what it's hard to assess currently because we don't have this baseline data. So last year we made this decision, and we kind of registered the static figures that we approved, all of us, and we will try all together to achieve those, to understand where we are basically moving. So to implement this strategy, after a year and 4 months of working on it, on the 18th of June, the operational action plan was approved, and we are grateful to colleagues from the Ministry of Health and grateful to members of the government, because the document was adopted at the session of the cabinet, and that was a year and 4 months of the work to coordinate that with all the stakeholders. But we are so grateful that there is general understanding of why it's important to approve that. There was advocacy work conducted by our colleagues from the Ministry of Health, and now we have this plan approved. And this is the plan that indicates details, explains details of the strategy, where we are going to move. This is about the strategy to avoid new cases, improvements of effective detection, and access of comprehensive access to treatment. So if we speak about prevention section, which is included into the plan, and we have target values for activities to prevent HIV among key populations. I will not repeat that. We have that on, you have that on the screen and in distribution materials, handouts, and we'll speak about testing today. So these activities are being implemented via contracting NGOs and for provision of services for prevention among key populations.
It has been already several years that these activities are funded from the state budget, from the full-scale innovation. They are implemented in line with the state policies, but our key donors, our donor is Global Fund. So the Global Fund agreed to provide funding, but all the procedures and approaches would be kept the same. So yes, we have updated the procedures this year. So the next objective is elimination of transition of HIV infection from mother to kid. Although it is not the topic of our today's discussion, I'd like to express my gratitude to the National Committee who work with the regional teams for keeping the level of these figures. If we, in the context of other European countries where they have no war, Ukraine has a very decent position. We have a lot of things to be proud of, but still have a lot of work to do. The next objective is pre-contact prophylaxis. Here you can see the figures, the achievements reached together with our partners under the precise coordination of the national team. However, so it is far from being perfect, and we have to work here a lot in order that pre-contact prophylaxis is available in any healthcare facility, and that is provided by any specialist who could provide clarification and prescribe such prophylactics. If we go into the project Reach 95 is primarily focused on improving testing. In terms of operational aspect, we do have targets. I mentioned that we've been developing the plan for more than 1 year. So, and actually in 2023, we have already reached the targets set for 2024. But it doesn't mean that we should have a rest. Here you can see the key figures on testing for key groups. In operational aspects, the focus is made on different testing modalities. Here it includes self-testing, health testing provided by healthcare workers, etc. I think the colleagues will find details information. So it's not only about different key groups, but also different testing modalities. So in terms of treatment, I'm not going to go in depth, but like to mention that our objectives are highly ambitious, and despite the fact that we have overreached the target on testing, but the number of identified number of persons in treatment are really ambitious, and here without your contribution, without the contribution of the project, we would not achieve the result. Next point is virus burden. So this is the third one, which is impossible without the previous one. The cross-cutting target includes information, comprehensive information campaigns focused both on broad public and young people. And what Svetlana mentioned, it is in line with operational plan, systemic training activities, both for professional and priority groups of law enforcement authorities, educational institutions, military, and also ensuring access to replacement supportive therapy. In terms of the information here, we have a lot of work to do. We have a lot of things to settle ambitious objectives and move forward. So I'd like to mention partner during the previous cooperation. We were not engaged, but you are all aware that we have already the already to is engage the colleagues from the regional CDCs for at the regional level about infection surveillance, etc. So they are assigned as responsible for genomic surveillance. So so in the slide the logos, but anyway, I'd like to reiterate, please engage the colleagues from the CDCs to the project activities. Yes, just a couple of words. Yes, we do plan efficient and close cooperation with the regional CDCs, and from September this year, and also we included in the action plan for the second year of the project cooperation with the regional CDCs, and together with them we are going to map the HIV in morbidity in each region, and together with them we will identify and maybe review the patient routes, the points of providing services where they are most relevant, where decentralization is needed. And together with the, together with the CDCs, we will review the our partners for this second year. So during the meeting with the Deputy Minister Kuzin, the leading role of CDC was emphasized. So yes, we will definitely work with them closely. Thank you, Svetlana. So we have already a lot of discussions. We have the same understanding. Just to finalize my presentation, I'd like to say that the approved operation plan proves the importance of the key areas of our activities. And just to mention, then the Public Health Center is your reliable partner. We share your approaches and we suggest new approaches. Very important different types of discussions are here, but I really appreciate that you can hear us and sometimes follow. You don't need to advocate and you don't have to convince us. We share the same objectives. So this is the final words for my presentation. Thank you. Over to Larissa Hetman, National Coordinator, National HIV Coordinator in Ukraine. How long do I have? Yes, we will still have time for Q&A. So my presentation is devoted to implement the public strategy on providing HIV services. And I will focus on cross-cutting issues on HIV testing. The national strategy was approved several years ago, but we can see that it's still relevant today. Because it's a high level of awareness of HIV status. It's the first 95. So ensuring HIV testing coverage for key groups and the people with TB, the people with supporting and replacing therapy. From our previous experience, we do know that that is the groups of population where HIV infection is most likely to be identified. Ensuring full access of pregnant women to HIV testing and timely testing of babies born by HIV positive mothers, and ensuring access to testing through innovative approaches. Self-testing, tests in pharmacies. I think self-testing doesn't sound as innovative as in 2019. But talking about broad implementation nationwide, it is really relevant, and the guarantee of laboratory testing is also very important today. Cascade, you can see the data since 2017. Actually, our data, to some extent, are our challenges at the same time, and also the evidence of success, of progress, the resilience of healthcare system in Ukraine. Evidence that despite the full-scale Russian invasion, the system is operational and collects data, analyzes them, and compares them. Despite the full-scale invasion and the challenges that we have mentioned today, and we will be talking about them, we have 79% of the first 92 as of end 2023. Increase awareness on HIV status. Just like to remind the rest of our international colleagues who, at the beginning of the full-scale Russian invasion, said, "You are doing the best in the West in the worst conditions." That's really. We thought that COVID-19 is the best possible scenario, but unfortunately, we faced a much more worse situation. Fortunately, it will eventually end. But if you review 2020, 2021, 2022, we can see the decrease in testing coverage. We have discussed the challenge, changed the approaches, and by the end of 2023, we overreached the 2021. So in this very hard time when logistics and transportation is impacted by war, we are quite successful in keeping the cascade of bringing people to medical support. We can, in relative figures, we have decreased, but talking about absolute figures, if they are, if not at the level of 2021, so they are comparable to 2022, 2023. So already mentioned the testing with the key groups. It's implemented under the implementation of technical assessment, international technical assessment, and state program. The state program cover up to 20% of the population, but we increase the percentages. In terms of efficiency, it is can be discussable, but as we discussed with the 100% of life and Alliance in public health, currently the entry points and accessibility changed. The war changes everything, including accessibility to key groups, includes migration, and especially we can see among sex workers. And the discussions will continue in terms of changing or amending the procedures that were designed in peaceful time that they are not relevant in wartime. This is the processing process. Transferring HIV from mother to baby, and probably the first point in this barrier is timely identification and with pregnant women. The key indicators settled by the UN and enshrined by the Ukrainian government. They are kept, but here we have nuances by regions, and for the first and second testing, we will discuss this point by generally. Nationally, the indicators are quite distant, and this is the example when the pilot projects become institutionalized. In 2021, under the support of the Global Fund, a small number of regions launched pilot on testing pregnant women for HIV and syphilis. At the same time, it proved to be efficient. Later on, it was scaled up in 20 regions, and currently we are amending the regulations which would enable improving these tests nationwide as a routine testing. The issues related to accessibility to testing, because again, innovation, it's the building up of capacities of primary health care, and in terms of in terms of new packages offered by the NHSU. We monitor the situation in order to scale up their experience. So the program.
So when there were just several packages for HIV testing, and we could see the situation there. Currently, this is 13 packages, and well, maybe this is not yet the perfect situation, so there is still room for perfection. The mapping of services and extensive access to this mapping. I don't intend now to read all the slides out, but I wanted to indicate that at the legislative level, at the level of the law on HIV, these modalities of testing at the initiative of the medical work, self-testing, index testing, assisted testing, the testing at the level of NGOs, they have been documented. Some feel the changes at the level of bylaws, some still need to be developed, but the foundation that all of us developed when we developed the law, that when we advocated the law, well, that's really something that can be implemented further. Testing at the initiative of the medical worker. Here we see increased coverage And that's what we where we have results, especially versus 2022. The standards of medical care include HIV testing as an indicator. That's also a sign of progress. And also assessment of HIV testing services in healthcare facilities that are held in the framework of technical assistance monitoring visits and with the support from WHO. Well, on the annual basis, the roadmap is updated, and that's the guiding thing for the next year. Information materials, all of that, of course, contributed to the situation where we now see that despite the priorities, important priorities, so these are very important priorities, but still HIV testing remains a relevant issue. And this is the list of medical care packages where HIV testing is indicated and must be implemented. At the same time, our yesterday's visit with WHO colleagues to one of the regions of Ukraine proved again that this is not yet a perfect situation, because in many standards where the speciality, well, actually it is relevant for testing. So in many respects, HIV testing is absent, and colleagues refer to that. They say like, sorry, but in our standards, we don't have that. Then awareness raising. We are very grateful to colleagues' innovations to overcome HIV from the beginning of full-scale invasion. With their support, we developed chatbot, ART, close by, testing close by. So those people who started migrating and who were losing the connections, the links via the chatbot, they could contact and understand where the services are provided. We are moving on. And I can announce that soon it is going to happen, and via Google Map it will be possible to scan and to find testing points within the facilities where ART and TRAP and HIV testing are available. So these innovations regarding devices and all the other things, we are working together, and the potential that we have at the country level, we try to use it to the extent possible. And it is in application, dear application, right? Yeah, thank you for correcting me. Okay, so regarding the CDCs, this is the regional actor that probably was undervalued in the previous periods. And this does not undermine the proactivity or the level of responsibility for all the actors who work at the level of governmental and non-governmental organizations. So regional CDCs who within their capacity can join in and coordinate those aspects, definitely they need to be involved. So with the support of the Global Fund and via the PHC, we are going to implement kind of a pilot activity with coordination of the CDCs involving the facilities. There will be visits of the teams who will be able to test or to hand over the biological specimens. This is about information raising, awareness raising campaign on high-risk behavior, everything relating to prevention and treatment. So that will be implemented. Early detection of HIV among children. Children are probably most vulnerable to ill-timed HIV diagnostics because that results in very quickly negative consequences. So with the support of the Global Fund, previously GenExpert, devices were procured, and actually the equipment with the tri-spot work. so that these services could be provided at the level of each region so that we didn't waste time and money for logistics and for diagnosis. And now quality control aspects. Just a couple of comments about what's happening already. With the support of the Global Fund and PEPFAR, when using the PRRCT questionnaire, well, here you can see comparison for 2 years, 22 and 23. This is baseline assessment and the comparison, how the situation changes, where the color changes from red or orange to green at the baseline assessment and after the next visit. This is an automated questionnaire that makes it possible to provide quite an unbiased assessment and for us to see where we need to focus our efforts to ensure the further improvement of the situation. This is an example, 2023 baseline assessment versus the second visit, and you can see in, well, this is not a full list of items that are assessed, but you can see how the situation changes when recommendations are provided for regarding quality control. External quality assessment evaluation, this is what has been mentioned today as well, and during the previous periods as well. It has been conducted at the regional level with the support of the Global Fund and PEPFAR. And we can see how the number of participants is increasing, those participating in external quality evaluation, and how the result is improved. And at the country level, we achieved the target indicator 99% as recommended by WHO, but we see that by region, the situation may vary. In red, for example, you can see those regions where the situation is has deteriorated. In orange, you can see those where it remains unchanged. In green, this is where it improved. So, of course, we need to keep in mind the aspects of external quality evaluation, and that will be supported in the framework of the project. That's great, and we need to coordinate this further. Now, verification of algorithms of testing. A survey was conducted that helped us find answers regarding use of tasks in the algorithms of testing to avoid false reactivity. And there are links to this trial if you haven't seen that yet. And we see demonstration based on the country level testing. And to be unbiased and to be progressive, we see that, well, we need to repeat these surveys and these trials because the list of actors may change. Next 3 slides are about amendments to the legislation that have been already implemented and those that are ongoing. There are regulatory acts that we know must be revised, and we understand what that's going to be about, because with the modern approaches to HIV testing, we cannot lag behind, and that's good. That means that these are working documents, they are dynamic, and we keep working with them. A couple of words about training. Demonstration of how many service providers, well, this is about HIV testing, and there were tests, and this is a non-exhaustive list of online training opportunities. So you are welcome to use this resource. You can do that in a hybrid format in the framework of our activity. We apply this rather successful practice. We see that based on test results and on feedback, where some of the classes are taken online and some classes are attended offline, especially where we develop practical skills. So hopefully we will continue using that. And actually what we hear from our colleagues at the regional level, we see significant need for offline training. And this is a brief cycle on rapid testing. and access to testing, detecting those who are subject to testing. This is the standard of medical care, and the evaluation that is held with the support of WHO colleagues. I believe that based on results of first half year or another period, we will be in the position to show that taking a wider time period. We keep discussing that at collaborative meetings that we organize all together. But even though in 2022-23, we saw significant development of healthcare worker initiated testing, not everybody does that. So this is still, there is still some room for perception. Now, developing the needs. So there is so to have the materials, the input to work with, you need to conduct the assessment. So now the methodology for this assessment is now being considered by the Ministry of Health, and hopefully it will be approved soon, and we will have the respective approach. So at the country level, we generalize information on the on inventory, and we try to see where critical situation may develop to distribute rationally, and quality control as mentioned. This is the methodology for the estimation. I will not focus on that now. We can discuss it in more detail later. And another important aspect, this is epidemiological surveillance of HIV with the support of PEPFAR and American CDCs. We managed to implement the project for the recent HIV infection. Again, this is the best practice where project is now a routine practice, institutionalized. Hopefully it will soon start being used at the level of all the regions, and this is the percentage for recent infection. So on the routine basis, all the new cases, they are subject to testing for recent infection. And thus we have on average 3%, but there are regions where the percentage is 13, 9. And of course, these are the regions where decisions must be made, where we need to speak at the level of epidemiology about the impact on the epidemic. Now, if we speak about this area, it is also scalable. We plan to include 2 times more regions and facilities into this intervention. Achievements, they have been mentioned today already, so maybe I will not go into detail of that, but let's speak about challenges. This is limited access of patients to services because of the full-scale aggression, destruction of premises, of laboratories, potential reduction of quality of care, and because not only patients but also qualified staff who migrate, so time is needed for training of new staff, a lack of automated electronic tools, e-tools. This is rather about the database that at the country level, well, if we speak about epidemiological surveillance that we could use, and the lack of including HIV services in narrow sectoral standards, developing the link between HIV testing and PrEP, because not all those who have negative tests are referred for prevention, and of course professional burnout of medical staff, and not only because our work is about work of is linked with work of NGOs and partner organizations, so this is relevant for us all. And thank you for your attention. Glory to Ukraine, and I'm so grateful to each of you who has contributed to this presentation. You can see the names: Diana Shevchenko, Stratsenko, Bondareva, Adrianova, Babi, Marcinovska, and also I'm grateful to all the colleagues here in the audience and who keep working in the regions, because this is our joint data and work and success. Thank you, colleagues. Thank you. Thank you so much, Olga and Larissa. And let me say that our team of Reach 95 project is holding ongoing meetings on the monthly basis with the management and fighting HIV infection of PHC led by Larissa. We have them on a regular basis. We discuss all the initiatives that we plan to implement and all the challenges. And it's very nice where you see that the work of International TA project fits very well into implementation of the plan that has been adopted to implement the state strategy to counteract HIV in Ukraine and all the national approaches to organize provision of services for HIV testing. They also are reflected in implementation of activities of Reach 95 project. And now you have the unique opportunity to maybe ask questions and to comment. We have like 4 minutes for that. Any questions in the audience to the representatives of PHC leadership? Comments? Okay, we will have the opportunity for informal communication. You will be in the position to ask questions. And let me say thank you to leadership of PHC. And you see that this is a high representation level, and this is the key state institution, PHC. Thank you for being here at the launch event of Reach 95 project today. And this is about accessibility of quality, patient-oriented comprehensive services in Ukrainian healthcare facilities. Thank you so much. A round of applause. Thank you. Okay, so then now we are going to take a break. And we will also take a break in broadcasting on YouTube on the platform of the National Training Center. We take a lunch break here from 2 to 3. And you're all welcome to join us at 3. Join the National Research and Practical Conference launching Reach 95 project.
Ага. Там ще не показуєте? Добре, добре. Мгм. Вітаємо, вітаємо, повертаємося до
Welcome.
прямої трансляції.
So we are back to the live broadcasting on the National Training Center platform of National Conference on Launching Reach 95. That is the project aimed at ensuring access to quality HIV services in Ukrainian healthcare facilities. So we are back to our live broadcasting. So welcome, dear participants. Just like to reiterate that you have to register. It's only today that you can do that as at the platform over the test center of the Ministry of Health of Ukraine. And tomorrow, since noon till 23:55, the questionnaire will be available, which with only 10 questions on the topics of our training. In case if you provide 7 right answers, you will get the certificate of the National Training Center and International Organization Path on successful participation in of the conference on launching Reach 95 with additional 20 scores on continuous professional education. So just to remind you that the National Training Center and the Ministry of Health of Ukraine registered 2,465 participants. So to continue our conference, we start it with inviting our dear partners, dear colleagues to the panel. I'm inviting Dmytro Sherenbey, Head of Coordination Council, charitable organization 100% Live. And just to add that cooperation between Path and 100% Live has been lasted for many years, and as of today, it is the biggest NGO which was established by people living with HIV. So we can tell a lot about that, but probably Dmytro would be the best one to tell us about the activities. I really appreciate partnership of cooperation of 100% Live, and they, together with the Public Health Alliance, were implementing the previous PERFAR project supported by USAID, which was the name Health Link. The project was implemented during 7 years, and our current project, Reach 95, will learn from the experience and also continue implementing the innovative approaches introduced during the Health Link project. So actually, it's a lot of many years of efforts, passion to protect people living with HIV and fighting stigmatization, including from the side of healthcare workers. So I am inviting Dmytro Sherenbey, Head of Coordination Council of Charitable Organization 100% Live. So, and also we are going to have Volodymyr Kurpita, Is he going to talk about public NGOs? No. So I have 20 minutes. Yeah, right. So who, I think everybody of you knows about the charitable organization 100% Life. So yes, it is the question with an obvious answer. So I'd like to reiterate that we can understand the importance of NGO organization sector, but you should know the value of their role. Do we have somebody from Chernihiv? Yes, my dear friends. Yes, in the city of Chernihiv, it was more than 20 years ago that I was diagnosed. At that time, the healthcare system was in the condition that they told me, you have just very short time of your life. There was no available treatment for HIV. You might agree with this life scenario or oppose it. At that time, the government system, the state system, offered you just one scenario. You will live the life. And a very small group of people in Ukraine got together in order not to agree to accept this scenario in the future. I'm standing here in front of you, and for me it was very important that I have the right to fight for my future, and I can put my efforts to protect people, other people to live. So, and we have to call them to life. Today, our organization provide one fund employs 3.5 thousand social workers in all our projects. We have representatives office in all over Ukraine. We also work in 10 other countries. We also support our government. If you go back to this opposition of the NGOs was really very successful. Just in the recent year, we have supplied more than 500 planes of humanitarian support. All information system EMIS, eHealth are the let's say children of the information system produced by us. 6 years ago, it cost 50 billion a year. Now, when you visit health facility, you have the whole system, comprehensive system. Due to the healthcare reform and all the very important components we have implemented today, the cost of the system is only 290 billion. It is 6 times less. We could agree with the Ministry of Finance, who said we have no money, like me, that I could agree 20 years ago that I had no future. We could agree with the fact that Ukrainian healthcare system cannot be reformed. With all this fight, those very simple things we use today, very common things we use today, it was the non-government organizations who opposed the common scenarios, who wasn't a passive consumer. And now it is quite difficult to evaluate what is the value of NGOs in Ukraine, or the value of all the changes initiated by NGOs. The civil society is actually the only one who has been fighting for changes in the healthcare system. Usually you will see the patient movements in the front line who, despite the threats of Minister Bohateriov, we have forgotten. So actually we have survived 16 healthcare ministers. If you want to know what is the most stable system, it's me who is standing in front of you, and we will be able to survive even 16 more. And the biggest secret of our survival is our motivation. Every time when the new minister came, when he tried to monopolize everything unto himself and corrupt everything, I clearly understood that subordination in healthcare system wouldn't allow doctors to tell the truth, because they would be threatened, they would be dismissed, they would not be allowed to perform their professional activities. And this very humble voice of patience was the key one when the doctor was dismissed, and every minister who came and thought that they would be in position for ages, and they always know me and I know them. They eventually all changes. So our motivation is to build the future. It is decent future. So as of today, we have passed the way of 20 years, and we are resilient in a very challenging context of current Ukrainian history. The civil society, the 4 months before the war, designed the security actions, how we will live during the war. We described all logistic chains. We moved sensitive information. We evacuated children and families. We did all that. We believed that the official public healthcare officers system would do the same job, that they understand that that would be a very severe one. But this area has its figure. It's really awful when people meet the future and they are not prepared. Civil society proved to be resilient, sustainable, and its commitment to changes. If you want to make bits on something, do them on civil society. So in order to get the real result which is required. I think that someday the history of civil society will be written, and there would be a chapter called Untold Stories. It's what you are told in the NBU, in the SBU, in the presidential office, how they want us to be silent when it pains to them when something should be changed. It's not just bad words said to me. It was a real statement what should be done with me if I do not agree. And I really appreciate my team and all civil society that they do not compromise their conscience. Because being silent, it's not the issue about our comfort. It's about thousands of lives, and you will have to live with that. I do realize that any international program that enters Ukraine today and makes civil society its partner is bound to success, because it is the issue of motivation. People who strive with changes, they get any possible means to reach it. We implemented Health Link. It was a 7-year long story. So we have been working in that program and some other programs. I still have 5 minutes. So and now it is your role in this, on this pipeline. It is in fighting death, so there would be no individual winner except for the person who is threatened. finally, the key indicator of our activities, which we convey now, is the number of lives to be saved. All the rest is of no meaning. We will say nice words to each other about our work, but eventually at the end of the year, we will have to conclude what is the number of lives we've saved. Even for us and for everybody, it would be the key indicator. And for us and the representative of healthcare sector, it is the highest level. It is why you choose that profession. Never this value can be the second top. Suppose if you come back home and you look at your children and imagine the question, how many of them would survive? You would never agree on this choice. Us as civil society would never agree on that choice. We would fight for the last patients, whatever it would cost us. We would change financial policy. We would try to dismiss the ministers. We will fight to make life the priority in our country, not the roads, not nice administration or nice hospitals, but life, so that it is integrated in each head and each decision taken. It's not declarative joke. So what if you want to, if you ask anybody, do you want that 20% of your child survive? It's not nature, it's anti-nature. The same should be in the management. It couldn't, it's unacceptable. It's unacceptable in behavior of personnel with common sense. I think that this value would be the factor that join us together. That you will understand that our sometimes very brutal behavior and sometimes even anesthetic behavior, it's because of our value. For us, it doesn't matter how we are evaluated from external. Yes, quite often we do not like as in nice manner that we would like to be. But you know that we are efficient. And this statement that life is the value of one is the flag that we give.
Найважливіших, знаєте, результатів проєкту HealthLink, який реалізовувала БО 100% життя разом з Міжнародним благодійним фондом Альянс громадського здоров'я, є 1 мільйон врятованих життів. І те, що, скажімо, ті цінноти, які завжди керували діяльністю БО 100% життя, дійсно дають нам наснагу і розуміння того, що без громадського суспільства, без роботи такої великої, розгалуженої, скажімо, системи людей, які живуть з ВІЛ і є членами цієї організації, неможливо реалізація міжнародних проєктів технічної допомоги. І, зокрема, в нашому проєкті передбачається співпраця з БО 100% життя, зокрема, з проведення індексу стигми тих досліджень, які проводяться саме БО 100% життя вже, мабуть, 7-й або 6-й раз. І, до речі, в рамках нашої конференції будуть лунати перші результати проведеної в 2023-2024 році дослідження індексу стигми. І те, скільки вкладає БО 100% життя своїх зусиль, своєї прихильності,
our heart in overcoming the epidemic in Ukraine. And this is the experience that is in our project, and that will be implemented with 100% life. Thank you for your charisma, and to all the team and the 100% life. We wish you that you keep the line and that you keep doing what you've been doing for 20 years now. pass the floor to Mr. Volodymyr Korpita, who is the director of USAID Innovations to overcome HIV epidemic implemented by Pact in Ukraine. And to start, let's start with a couple of words of welcome for our audience. I'm going to present further on, so I will not take long. So let me congratulate everyone on the official launch, even though I know that a lot of preparatory work has been done. And when launching the project, it is always important because it goes as you start, more or less. So congratulations on the start, and I wish everyone active work and good result. And I would like to emphasize that everything that we are doing now, this is for the sake of our victory, for the country to survive, and that the achievements that we have in Ukraine were not lost because of that crazy neighbor that inflicts so much damage. And then further on, I will present. Okay, thank you. And thanks for the entire team of USAID Innovations to overcome HIV. This is the third year of the project that you've been implementing the project, right? And you're going to speak about that. But let me emphasize that Reach 95 works with the project of innovations to overcome HIV epidemic, and the activities implemented by the innovations project, the unique innovative approaches to work in the communities, that is something where we will also collaborate to avoid duplication of services at the regional level, at the level of healthcare facilities. So now you see here two of our key partners in the framework of implementing Reach 95. And in order to now present the next speaker, who is going to join us online from the US. I'm now checking with our tech guys if everything is ready. So my first question to you would be this. Do you all know what N equals N is? Yeah, I guess you do. So this is in Ukrainian, basically. So in English, it is U equals U. So I pass the floor to Bruce Richmond, who is founding executive director of Prevention Access Campaign, Pact. This is our key partner implementing Reach 95. And the strategy of this strategy, U equals U Undetectable equals Untransmittable, how it started at the regional level and how it was developed in Ukraine in particular to ensure control over the HIV epidemic in Ukraine. So the floor is yours, Bruce.
Thank you so much. It is really, truly such an honor to be here. I want to thank all of our Reach partners and congratulate you on this exciting journey that we're on together. I will see if I can see my slides. Are the slides showing? I'm not able to see them on my screen if they're showing. Okay. I do have some slides to show, but in the meantime, I will explain what the slides will be until I do see that they're up. So first, I'm going to talk about what U equals U is, or N equals N. It was great to hear that most people in the room know about it. Then we're going to talk about a bit about the history, how that it came about. And what's the impact of U equals U? What are we seeing around the world, and that can be really applied in different ways in Ukraine as well. And then overcoming barriers to U equals U. We're going to talk about some of the common barriers that we see to ensuring that, there it is. Okay, I can see the screen. To ensuring, okay, next slide, please. Great. So then we're going to talk about in ensuring that we're communicating about U equals U properly and effectively so that it has a positive impact. And then we'll just summary and wrap up next steps. So next slide, please. Okay, and first I really want to acknowledge Public Health Center. Just a few weeks before Ukraine was invaded brutally, I was in a conference with Public Health Center and looking at the programs that they've already done in Ukraine, and I'm really impressed, these H equals H programs. So I want to pay tribute to the work that's already been done. Next slide. And also to 100% Life, which was one of the first organizations worldwide and the first network worldwide to join the U equals U campaign. And this is really back in 2017 when U equals U was very controversial. So my heart goes to 100% Life for your pioneering leadership with U equals U and all the work that you're doing currently in Ukraine. You're really truly heroes. It was it's an honor to be here with you. Next slide. So what does undetectable equals untransmittable means? It means that someone who's living with HIV, who is on treatment and has an undetectable viral load, has zero risk of transmitting HIV through sex, or if they have a detectable viral load under 200 copies per milliliter. Next slide is a better graphic on this to show you. So you can see that there are three actually new categories that the WHO presented for viral suppression. One is someone who is unsuppressed, and that is when the viral load is over 1,000 copies per milliliter, and that's when you really need to be worried about certainly about transmission risk and about what's happening with the treatment regimen, and to look at potentially changing treatment options at that point for sure. And then also the suppressed category, according to WHO, is less than or equal to 1,000 copies per milliliter. And that has a new category called almost zero risk. And I'll go over this again in a little bit. Almost zero risk, so there's an or negligible chance of transmission when the viral load is above 200 or 200 or above. But when we're looking at under 200 copies per milliliter or an undetectable viral load by any test, that's zero risk of transmission. So someone could be receiving a viral load of 150 copies. That also means zero risk of transmission. That doesn't necessarily have to come back as an undetectable result in order for someone to be able to feel comfortable and confident that they won't pass on HIV to their sexual partners. This also applies through pregnancy and through childbirth. If the parent is undetectable and taking ARVs throughout, there is a less than 1% chance of transmission through breastfeeding. So there's still a very small, insignificant chance. And I'm going to mention a little bit more about the WHO guidelines on that. There isn't enough scientific evidence to show whether U equals U applies to needle sharing, but it most likely is greatly reduced for that route of transmission as well. Next, but we can't say U equals U applies. So next slide. I just want to also mention this new WHO brief that was released last summer at the International AIDS Conference in Brisbane to cheers. And people were calling this brief a revolution. The brief isn't really getting distributed very much throughout the field. So I try to talk about it at every chance that I get because it's so important. And I'm going to show you why on the next slide. So first, this is the first time that any medical globally recognized public health institution, let alone the world's leading global health institution, says zero risk of transmission from an undetectable viral load. And that's really important because I'll talk a little bit later about, we see a lot of hesitancy for folks to be really clear in their messaging. And there's no ambiguity with zero. Zero is zero. Also, an undetectable viral load can now be confirmed by any kind of test, WHO-approved test. So that could include more scalable options like dried blood spot tests, which don't require complex transport from collection to lab, like plasma tests. So previously, the guidelines defined undetectable as under 50, which really limited to plasma tests. Now, the WHO is really encouraging scalability over precision for viral load tests. So that's exciting about access. And we really need all governments to understand that we can be using these more scalable options like plasma-based tests for viral load testing. Then, as I mentioned earlier, there's that new category, the suppressed but detectable. Between 200 and 1,000 is almost zero negligible risk. So that means many people who are in that category can now have comfort that there's really just such a low risk, they shouldn't be worrying about the transmission risk at that level. Although we really do need to be looking at what's happening with having a viral load at that level and be engaging in adherence counseling or potentially treatment regimen change. And then also the WHO, there's a line in this document that recommends breastfeeding for women taking antiretroviral therapy. We know in many parts of the world, women or parents are being criminalized for breastfeeding their children when they're undetectable. It's not just on treatment, but they need to be undetectable. And it's really important to get this message out to protect the rights of people living with HIV and to encourage safe breastfeeding. Next slide. Oh, that was backwards. So next slide. Okay. Oh, wait, actually, could you go back? Sorry about that. Go back to that slide. Okay. Yes. So this is okay. This is very briefly. How did we get here? How did this happen? This just didn't happen. The CDC didn't just decide to change decades of definition of risk. It was a really coordinated effort between the organization that I work with, Prevention Access Campaign, and activists and researchers and health officials. We came together in 2016 to build a consensus on the science. So we looked at all the research and we put a statement together confirming U equals U is true. And we did that and it worked, and U equals U is now endorsed, and I'll show you that in a minute. And then our goal was to disseminate the science and advocate for quality access to everyone. So we're really working on 2 and 3 because number 1 has been confirmed. Next slide. And this is based on 20 years of robust evidence going all the way back to the Rakai study. So the evidence is solid. I'm not going to go into the science today, but it's there. Next slide. And now we know that U equals U is so solid that it's a mandate of PEPFAR and the Global Fund. So it's required, U equals U education is required of all countries of the PEPFAR and Global Fund. Next slide. It was also adopted by the UN General Assembly and the Political Declaration on HIV/AIDS. So it's a marching order of all UN agencies as well to make sure that this message and this science is distributed and understood. And that's really what we're doing here today. But this really started many years ago. And it's next slide. Based on activism from the earliest days of the response, U equals U is truly community-led. Next slide. It's not well known, and you can see behind me, and then in the next slide, please, that there is a movement all over the world, and every region of the world, people living with HIV are coming together to ensure that this message out, protesting and pushing their governments and their national organizations to make sure that this message is heard and understood by everyone. Next slide. And now this movement has a massive partner network in 105 countries, as I mentioned, including 100% Life and Public Health Center. Many of these are actually governments. You know, the Australian government just recently signed on, Vietnam has signed on, Canada, Zambia, other countries. Next slide. And this is so important to understand why U equals U is important. So one of the greatest barriers, and we'll talk about in a minute, is people sometimes think that U equals U is just for people living with HIV. It's just for us. And that should be enough. It should be enough that it's just for the quality of life of those of us with HIV. But there's more than that. And I do it for the quality of life for people with HIV, but it also reduces HIV stigma, which we know is the greatest barrier to ending the epidemic. And it propels us towards each of the 95 targets. And I'll show you that in a minute. It's reforming discriminatory laws, policies, and practices everywhere. We saw marriage licenses being offered to people with HIV now in Oman, and people can serve in the military now in the UK, and criminalization laws are being reformed based on U equals U. It's also a clarion call for access to treatment. So we're using U equals U in our advocacy, because when people with HIV have what we need to stay healthy, we can't pass on HIV, and that's good for everyone. That's why we call it a win-win. Next slide. We're seeing that at each stage of the 95, there's data that show when you use U equals U and testing outreach, people are more likely to get tested for HIV, and people are more likely to start treatment and stay on treatment. It's a motivation to stay on treatment. And more people are virally suppressed when they learn about, when those of us with HIV, and I forget to mention, I've been living with HIV for 20 years. This is a motivation for us to stay on treatment, not only for our health, but so that we can have sex safely with our partners and feel confident in that. Next slide. And we're seeing that U equals U leads to positive health outcomes. So we're seeing an improvement in overall health, mental health, sexual health, adherence, comfort sharing status, and viral suppression rates, as we're saying, when people are informed about U equals U by their healthcare professionals. Next slide. And I was saying earlier, U equals U is a win-win. We have to approach this in our advocacy to governments, because now that we know that when investing in the health and well-being of those of us with HIV, making sure that we can get to U equals U has societal, public health, economic benefits for individuals and for the country. So it's really a win-win for us, and it's a win for the country. It's not just about individual health, it's about population health and strengthening economies. Next slide, please. So what are some of the barriers? One is just, that there's just a disbelief in U equals U. People just don't, still are not believing it, despite the evidence. So that takes a lot of repetition and continued education like we're doing today. Also concern that people will start having more condomless sex when they know about U equals U. Well, we need to just educate people that you don't need condoms to prevent HIV with U equals U, but might consider condoms for other STIs or unintended pregnancies. This isn't about throwing away condoms. This is about, other options. The other concern is the unsophisticated consumer. Maybe people won't understand what U equals U means. We think people with HIV can understand U equals U if we teach them, if we educate properly and in the right language and the right message. People with HIV are resilient, and we can learn. Also, lack of encouragement for HCPs. And U equals U is in certain countries of the world, it's still not in guidelines or strategies. So healthcare professionals are often not really guided or encouraged to talk about U equals U. And that's really, really important to have that kind of guidance. And that's what we're doing with all of you in this project. Then also not everyone can achieve an undetectable viral load, and there's unequal access to treatment around the world. That's not a reason to not share the message because of the inequity. That's actually a reason to keep sharing the message and use it in our advocacy to lift everyone up and make sure all people have the option to get to U equals U. And then also the skepticism and stigma just around people living with HIV, the judgment around people with HIV. This is about, those of us with HIV being empowered and free to have sex without condoms and without fear. And this can be really scary for people, especially because people with HIV are often already marginalized populations. Now we have the stigmatizing condition. And so breaking through those barriers and showing that, look, you don't need to like us. We hope you like us as people with HIV. We hope you end the stigma or the prejudice against us, but make sure that you get us treatment, because when we have treatment, we stay healthy and everyone wins, and that's good for the country. It's a public health issue. And then lack of awareness and education and funding is a challenge. Fortunately, we are working on some resources that we're launching at AIDS 2024 to make it easier. It's called U equals U University, in order to help train and support the workforce and countries in implementing and scaling U equals U more easily. So we'd love to have more resources available for education. Next slide, please. So U equals U should be communicated at each stage of the care continuum. We've had folks say to us, we don't talk about U equals U until people are virally suppressed or undetectable. Or why would we talk about U equals U? We're trying to get people tested for HIV. Why should we talk about it? Well, as I showed earlier, it's effective at each stage of the care continuum. So we need to talk about it in pre-testing outreach, and we need to talk about it and also in education and counseling and on diagnosis and at each stage of the care continuum. It's very important. Next slide. So next slide, thanks. So in summary, we know that U equals U is a proven concept. It's a global mandate, and it's a community-led movement. It's very rare to have both the sort of the top out and the bottom moving together on such a revolutionary concept. That has transformational impact for our health as people with HIV and for the population. We know that making U equals U a reality is fundamental for all the global targets, the 95 targets, as well as many national targets, and that overcoming hesitancy to U equals U is going to require multi-level approaches, consistent communications, clear communications, and that's why we're thrilled to be a part of this consortium. Next slide. What needs to happen? Folks need to integrate U equals U into government guidelines, strategies, policies, laws, and guidance. We're seeing that all around the world. We need to make sure that we're using U equals U in our advocacy to make sure that it can become a reality for everyone, for our health, and to prevent new transmissions. And we need to be doing a lot of what we're doing today, which is educating, encouraging dialogue among the community and healthcare professionals, policymakers, and communicating U equals U clearly, repeatedly, consistently at every opportunity for key populations as well as the public. Next slide. Thank you so much. This is my information here. I will be back later for the question and answer session. And again, it is such a pleasure to be here. Please feel free to reach out to me with any questions at all. We're very passionate about this partnership and serving the people living with HIV and affected in Ukraine. Thank you so much.
Thank you, Bruce. Thank you. Хочу сказати, що проект Reach 95 продовжує.
Just want to tell that Reach 95 continues implementing U equals in concept. A lot has been done in Ukraine by the Public Health Center and the key partnership organization in terms of implementation of the concept. And our our project, we have already planned a number of activities supported by Prevention Access Campaign. The organization that has designed the key concepts at the global level, and we will continue implementing
безпосередньо
these activities, including education activities, training. We will design the number of trainings for healthcare workers. His stigma stop here. So we
в
will
закладах.
we will stop stigma in our Ukrainian healthcare facilities, and it is exactly with prevention access campaign we will successfully operate in this area. And now I am giving the floor to Mr. Volodymyr
Почути
Korvita,
про
and we would like to hear from him about the innovative approaches implemented under the USAID
саме
Community Action for HIV Control project in terms of HIV testing services to key populations in Ukraine in the whole context. Volodymyr, over to you.
Ще раз доброго дня.
Once again, welcome everybody.
Я був з часом був дружив. Через це спробуємо, да. Ні, не буде дзвонити. Ага, давай.
I'm not going to call,
Я хотів би
so
почати.
just
Сьогодні конференція,
to start that we
ПАК.
have this conference organized by Pact, and we just had the presentation by the
Історія в нас
representative of Pact, and I am a representative of Pact, and we are all different. But as Svetlana mentioned, we are all partner organization, partner project, because we work in different contexts. When the activities and design on our project was designed, we decided that we are not going to work with the education institutions, but we are going to work with target populations, which eventually
програми.
would reach the educational institutions. So we contribute to the overall program. So let's start with
Назву не можна
the
скорочувати.
name, because it was at some time the donor said we cannot make our name short, and he said that the name should reflect the essence of activities. So in English, it is Community Action for HIV Control project. So the objective of the project is actually the same. We help Ukraine to reach the 95 objectives, and we have 4 targets. The first 3 were very from the inception related. They are related to HIV. They are related to US President's emergency plan for AIDS relief, and the 4th one is for our specific to Ukraine, is support to people affected by war. So yes, we are doing a very good job. We also have consortium. We are implementing our project in consortium with Pact, AFHR, and 360, and International Charitable Fund, East West Ukraine, and we cooperate with 20 NGOs in 16 Ukrainian regions. So if somebody, the slide contains the list of our organizations we work this year, we are working this year. For some reasons, the exact list a bit changes from year to year. Currently, we have 2 national partners. It's a hotline and 100% live network. We cannot get rid of them. I'm kidding, because we do need the information system for accounting. So one more important thing, that we launched our project in COVID era, because it was really a challenge, because everybody was sitting at home, testing was impossible. We were still in preparation, and then in February 24, the full-scale invasion started, and we have redesigned our activity, and eventually our activity was focused on helping those people who relocated and didn't know how to find the art, thanks to Public Health Center for Cooperation, which is still ongoing. From 2022, we started this type of activities. Our key focus is that we work with people who do not come to healthcare facilities for some reason. It's actually a big surprise that people live their lives and do not want and or cannot go to visit a doctor. So our objective is to reach such people, to identify them, to talk to them, to convince them to test, and to then to come back to the healthcare facility to get the results in order to reach the U equals U concept mentioned by previous presenter. On average, we test about 60,000 people per year. This year, our focus is a bit different. It's not about quantity, but quality. In other words, to test the people that really need testing. And this is what I'm going to talk about in my next slides. It is called innovation. I will list some of them, not all. Maybe some of them would be helpful for the new project as well. And the key point is that the human is in focus of all our activities, our communication with the public sector, with the clients, so that we should respond to their needs. And actually, so what is presented, it is what is offered by the government, and this is what the client needs, but they do not match 100%. But we revisit, review the systems in order to identify why clients do not come or do not come for the second time. And so this is this cycle when we get consulted with our consultant groups, get feedback, and then try to change approaches to implementation of the project. All this gives the results in the success we are talking about. The first approach we use is a strategic approach, which is called risk segmentation. For this end, this is a mathematical model which allows to evaluate who are our clients, who are the clients of our organizations, what are their profile, what do they actually need. We conduct such surveys annually. Just currently, we are in process of analyzing this data. About 80,000 tests were conducted, 77 unique clients. And the important things, I believe, require your attention over the public health facility is usually we were focused on young people, less 24, less under 18. So fortunately, in this age group, the number of new HIV cases goes down. Of course, we have to provide services to them, but they should not remain our focus. But the group 45 plus is 5 times higher than the age group 18-28. When people over 45 come to visit a doctor, we may even have an idea that they could be HIV infected, but I recommend to pay attention to that because 70% of new HIV infections, especially in our projects, are people over 39, and that it could be impact what you suggest to your patients. So then next approach is testing modalities. So the project suggests active search of new clients using index testing, mobile testing, risk networks, and also based on identified size. So it could be healthcare facilities because they are inpatient, let's say, facilities. So this is the difference. We try to convince our NGOs that testing in official organization is only 3%, is very low efficiency. The highest result is demonstrated by index testing. When a person, when we find a HIV positive person, and we try to unbound this chains of his or her contacts, and 21% is quite a very high positive. The total project result is 5.2%. It is so it's more than 4% of all tested people. It means that NGOs really test those who really need testing, but not just the broad population. There is a difference. Reach 95 is going to test public at large, but you could rely on our experience as well. The third innovation we are implementing, we are talking about differentiated with providing models. I wouldn't say it is an innovation. So we have been working since 2017. Actually, it is about systematization and documentation of facilities of engaging clients to our activities. They are individual. They cannot be standardized at national level because each region has its specifics, its population has its specifics. Here you can see an example how this model it looks like in one of the organizations with detailed time and place and addresses and what type of activities can be suggested. I mentioned the 20 executive partners, and they all had 57 such models. Some of them are rejected and some are in process of developing. Just the last week, we had a discussion. Should we develop the testing model based on military recruitment points? So we have still to discuss this, but this approach allows to standardize and access to the results and efficiency in order to ensure efficient investments. So what do this model allow to create? From the client's point of view, it's getting information and education materials, counteracting stigmatization, standardized system of support, and guarantee of confidentiality. For this, the healthcare staff, they receive regular training how to motivate clients, how to work with them It's very strict confidentiality policy on not disclosing status, and in the integrated set of services that we suggest to our clients for stress, depression, etc. For communities, it's the opportunity to increase accessibility and comfort of services, because we have feedback from the public health center and regional teams, then service providing standardization, and for the state, it's optimization of the quality and proper review and standardization of
ефективними, і вони деталізовані для соціальних працівників. Окрім того, ми для соціальних працівників проєкту розробили такі от карточки, вони як на чашах, які вони можуть взяти з собою, щоб не забути якісь нюанси, можуть повертатися до них, коли вони проводять бесіди з потенційними клієнтами. Ми також активно працюємо по поширенню тестів, саме тестів ми використовуємо слинні тести і кров'яні тести виробництва Mylan, які поширюємо через платформу «Тест вдома». Її хостить гаряча лінія, і гаряча лінія забезпечує тестування. По гарячій лінії можу сказати одне, періодично ця реклама, яка
So sometimes some blogger or TikTok blogger enters it, and then you have like waves of demand. And since we work with key populations, we introduce some limitations. We will see how it works, but the demand for self-testing exists, and some people do it for fun. Next year, this has started already, but next year we are launching the Go Poruch or NGO Poruch platform. This is an online platform that makes it possible for clients to register for services online, and then the services can be received based on organizations' platforms, or they can invite, it's possible to invite the social worker or just come and take some commodities from the organization. Go Poruch, this is adaptation of a large international platform. FHA 360 implemented that. It is implemented in many countries in the world, and it was translated into Ukrainian, and now it is tested by 3 organizations. Starting on the 1st of September, hopefully it will be available even more extensively. We invest in organizational development. We have specialized tools because we believe that not only technical knowledge, but also NGO systems need to contribute to that. So we have launched and we conduct a number of interesting aspects. This is ITOCA and OPI Plus and training courses for project and human resources management and community of practice. This is where people not only listen to the lectures, but they can discuss the themes that are important and that are interesting for them. So in every organization that there are these experts who contribute to change management and sustainability. So here we covered the names, but these are the special cards that speak in general about key aspects and achievements of organizations, implementation of indicators and the budget, availability of policies and people, and this is done on the annual basis, which makes it possible for us to compare various organizations. And together with our partner, the platform of key communities, this is another thing that we do. We conduct monitoring for accessibility and quality of services, and via this system that is organized by monitors from among key populations, we receive feedback from recipients of services, And we have it not only with healthcare facilities, but also with NGOs. We use the secret client method. It's not an actor. This is an actual person who wants to receive services and who goes to a certain institution, to a healthcare facility, or to an NGO. And based on that, then based on a special algorithm, this person shares the impression. And well, I mean that there are 268 healthcare facilities reach. It's not that on purpose we will attend your facilities, but some of them may be visited. And most often our clients who are representatives of the risk categories, they say that if I were not a secret client, I would not complete this procedure. And that's a pity, because it means that this approach and that Reach 95 offers for human centricity or patient centricity, that it is very relevant. And a lot of things depend not so much even on the amount of services provided, but on how the services are provided. And at the end, I'd like to quote Josep Borrell, who is the High Representative for Foreign Policy and Security. In 2022, in autumn at the session of the European Commission on the war in Ukraine, he said a couple of words or phrases that seem to be important. And among other things, he had this call to politicians. He said, undertake more initiative, be ready to show it. Never did that. Well, that's no longer an option. We have to start doing something that we never did before, because if we have doubts now, we will then regret that. And basically, this is what Dmytro mentioned at the beginning. And this is why I invite you in the framework of Reach 95 project, undertake more initiative, not to be afraid, maybe make mistakes and recognize those mistakes, but maybe it will help us improve our results. Thank you. Thank you, Volodymyr. Thank you for that you have presented these innovations in the Innovations Project. This is about the name of the project. And also, actually, it is expected that the secret client method that is implemented in the framework of USAID innovations to overcome HIV epidemic, that it will apply to project facilities that receive TA, Reach 95 facilities, because you remember that the second objective is reducing stigma and discrimination linked to associated with HIV. So we work together. We will work together, and thus we will be able to eradicate HIV-related stigma, discrimination, non-provision of services. I would like to say that actually our main observation is not so much about stigma and discrimination, but rather about bureaucratic processes and indifference. Of course, it can be included into the context of discrimination, but I believe it is not about HIV in general. This is about how the system treats patients in general, and thus overcoming stigma and discrimination, that's important, but I would not.
Що головна проблема – це відсутність емпатії. І на тлі війни це дуже сильно посилюється, оскільки, на жаль, наших медичних працівників…
Well, unfortunately, our healthcare workers, they are not taught empathy. Sometimes they don't know what to do about it. There is also the factor of burnout. So it is important to think about where you show empathy, where it is possible to kind of grant on that. That's helpful. Okay, now unique opportunity for you to ask questions, maybe some feedback to our two colleagues in the Presidium. No? Okay, then let's give them a round of applause. Dmytro, Volodymyr, thank you so much for this great component. And now I would like to introduce the next speakers and the next section. Here Let me say that when Mr. Kropita, the lead of USAID project, it was important to hear about how they implement approaches for risk segmentation. And in the presentation, you could hear that detecting HIV among 45 plus category of population, that there we see figures 5 times higher than among young people. So this is a relevant thing for Ukraine. And our partner, this is another partner organization in our consortium. This is the large academic institution, American University. Let us check if our colleagues are with us. Yes, now. So this is a large university, Yale University. And now I pass the floor to present these optimal approaches to provision of healthcare support for elderly people, for older adults, people living with HIV. So I pass the floor to our partners from the university, Dr. Shilashinoy, Associate Professor of Medicine, Yale University, Yulia Razanova, Associate Research Scientist of Yale University, and Dr. Frederick Altis, Professor of Medicine, Yale University. Dear colleagues, partners from Yale University, we are looking forward to your intervention. Floor is yours.
Бачимо вас, бачимо.
Yes, we can see you. Okay, so now we pass the floor to Dr. Sheila Shenoy and to Dr. Yulia Razanova from Yale University.
You can start, I believe. Thank you so much, everyone. We're so happy to be here today. We're going to spend a few minutes talking this morning about older adults with HIV, and we're grateful to the organizers today for including us on the agenda. On behalf of my colleagues, Dr. Julia Rosanova and Dr. Rick Altis, we're going to speak about challenges among providing optimal HIV care to older adults with HIV. Next slide. So we'll briefly talk about the global scenario, and then we'll talk about trends occurring in Ukraine. We will talk about older adults with HIV during crises, such as been going on in Ukraine recently. And then we'll talk about specific initiatives that we have been working with. And we'll talk about the impact of crises on healthcare workers briefly, and then talk about policy implications. Next slide. So we wanted to start by going over what's happening all over the world. So as we all know, globally, people with HIV are aging, thanks in part to the tremendous successes we've achieved through research and improved public health and improved clinical care of people with HIV that has resulted in extended life expectancy. Because of the global efforts to improve care with people with HIV and people at risk of HIV, we have improved longevity. UNAIDS estimates that the number of people older, 50 years and older with HIV infection has increased from 5.4 million in 2015 to more than 8 million in 2020. People are living longer with HIV, and therefore we have an increasing prevalence globally. So not only do we need to continue to think about HIV diagnosis and initiation of ARVs and adherence to ARVs and retention in HIV care? But we also, as our population of people with HIV ages, need to also be thinking about issues associated with aging, including comorbidities, and managing people with HIV and their antiretroviral therapy alongside other medical comorbidities, and thinking more about HIV as a chronic disease. So that's a challenge for us as a medical and public health field to think about improving care of people with HIV in concert with their other medical diagnoses. Another challenge that we have is making sure that we are considering ongoing risk among people with HIV, older people with HIV specifically. Traditionally, HIV initiatives and programmatic work focuses on key populations, on people with current or ongoing risk, including younger people, people who are using drugs, people involved in sex work, people who are in high-risk relationships. And we are often neglecting people who are older because we assume that they don't have those risk factors. We make assumptions about sexual activity, we make assumptions about drug use, current or previous, that ultimately leads to neglect among older adults. So older adults may not be getting diagnosed in the same way. And so that needs further attention. And then lastly, I just want to reiterate that when there's public health crises and humanitarian crises, that it exacerbates the challenges for medical care and public health care, as you all know very well. So specifically in Ukraine, COVID-19, the pandemic, has caused massive disruptions. And of course, you all know better than me the impact of the Russian invasion. Next slide. So here, I wanted to go over work that we have done with colleagues in Ukraine, looking at the proportion of among newly diagnosed people with HIV in Ukraine, the proportion occurring among older people in the country. So older people we are defining as people who are 50 years or older. That is in keeping with international definitions. So as you can see, in 2015, the proportion of newly diagnosed HIV cases that was occurring among people 50 years and older was 11.2%. And as the years go by 2018, this has increased to 14.9% or 15%. So this was a significant trend. And so overall, 1 in 6 people being diagnosed with HIV in Ukraine were happening among people older than 50. And so just to reiterate, 1 in 6 people with HIV, new diagnoses, is among those who are older. So this is something that needs a lot more attention. Next slide.
I'm awfully sorry, it's interpreter speaking. The slides are not shared on the screen.
Thank you. So on this slide, I hope it's not too busy. I've highlighted in red figures from Ukraine, national figures, and the bottom red rectangle shows the number of total diagnoses in 2016. So you can see the third box in is 842 total diagnoses among people older than 50. And the total number of deaths was 43. You can compare that to the row just above, 20 to 25, 373 cases total, and 1 death. So the proportion of mortality among older adults with HIV is much higher. And you can see in the next higher red rectangle from 2017, among 1,277 new cases among older adults, 75 deaths. And that number increases again in 2018. In the topmost red rectangle, 1,465 total diagnoses, 154 deaths. So we're seeing a disproportionate amount of deaths among older people with HIV, which is very alarming. Again, we need to bring more attention to this population. Next slide, please. Thank you. So in this table, I wanted to review work we've done, again, with colleagues in Ukraine, examining people who are older adults and younger adults, older than 50 and younger than 50, who are enrolled in HIV care. And you can see in the second column, those who are younger than 50, the characteristics. So 47% of these individuals were women. 41% had AIDS at diagnosis and had a median CD4 count of 295. And the next column, the third column, are those greater than or equal to 50 years old. And you can see again about 52% were women, 62%, much higher than the ones younger, had AIDS at the time of diagnosis. And their median CD4 count was 148 at the time of diagnosis. So significantly lower than younger people who were at the time of diagnosis. So, and then if you look below, also 57% of the older adults had a comorbidity compared to younger adults. So this is to highlight that, again, older people are being diagnosed at later stages of disease. They're more likely to have AIDS at the time of diagnosis. They're more likely to have significantly lower CD4 counts at the time of diagnosis. So this is a alarming and dire picture that we're identifying for older adults being diagnosed with HIV. So we need to think about the factors that are affecting and leading to this circumstance so that we can develop interventions to improve their outcomes. So now I'm going to turn it over to my colleague, Dr. Julia Rosanova.
Thank you so much, Sheila. Could we have the next slide, please? Thank you. So we have been working in Ukraine, Sheila and I, since 2014 and actively since 2017. And during the time, a lot of historical events have been happening. And the first event that was a major crisis was COVID. So when COVID struck, we were very concerned about how population of older adults with HIV might be doing and if they were able to cope. And so we organized our efforts, moving our research activities online to create a cohort of older people with HIV in Ukraine. And we recruited 123 such persons. And we first surveyed them in May, June 2020. And the questions in that questionnaire were related to their physical health, to their mental health, to their exposure to risks of COVID-19, whether they were isolating alone or with other people, if they had support from other people for their HIV care and care for other illnesses, and if they had any other concerns related to employment or sources of income and things like that. So we then continued to survey these people, and as events occurred, including the Russian invasion, we were able to maintain that cohort of people so that they were together altogether 5 waves of data collected. And here on this timeline, you can see that the second one was in winter 2022, then in spring 2023, and these 2 data waves were like really showing the difference between before and after the Russian invasion. And then the one wave was done. The last wave was in 23, and then there was a wave in at the end of 2021 and in the middle of 2022, so right after the Russian invasion. Next slide, please. So in this cohort of older adults with HIV, we had about half of them who had substance use disorder. And these people were, most of them had opioid use disorder history, and we had roughly the same number of men and women. So what was very interesting for us, we expected that there may be some differences between people who had comorbid addiction and those who didn't, but the results were not what we anticipated. So we learned that participants with addiction history had much worse mental health. So they had 4 times greater odds of having depression symptoms. They had 9 times greater odds of having anxiety symptoms. And they were 7 times more likely to have PTSD. However, they were also 4.5 times more likely to score higher on the brief resilience scale and to assess their own resilience and coping abilities with different crises higher than their counterparts who did not have addiction. So that was a very surprising finding to us that we are still trying to understand. And it could mean that people who have had a lifetime of difficulty can just be used to finding creative solutions to problems. Could also mean that they are better linked to care because they have multiple morbidities. And this help that they received during the crisis, both during COVID and during the war from clinicians, was what helped them to continue and be able to cope. Next slide, please. So what we found also is that the role of conflict was very significant to the lives of older people with HIV. So the 3 war-related experiences that were associated with mental health outcomes, with worse or better mental health outcomes, were receiving help from someone since February 24, 2022, receiving help from an organization or facility, and physically safe at home. So if people had that social support, then they were doing better. However, the presence of a substance use history modified this relationship. So if a person had addiction, then receiving help from someone and anxiety relationship was strengthened, but all the other associations were weakened. So generally, you know, if a person has addiction, that is a very significant single factor that makes a huge impact on everything that happens to them, even during the crisis. Next slide, please. So what we started to do in our work with colleagues in Ukraine was to try to develop and test interventions that would help in some ways this population. And so our first intervention is called PROST, and it stands for Peer-Run Optimal Strategy for Treatment. And that is a peer navigation program that we adapted from international intervention. And it targets older people with HIV who are out of care. And as my colleague, Dr. Shina, pointed out, there are quite a lot of those. And so we looked at those who are newly diagnosed and not yet been linked to ART, and those who were previously on treatment, but then they were lost to follow-up. And we know that there are quite a lot of those. So in the MIS database, we can see that there are people who were diagnosed even 10 years ago or 5 years ago, and then they never started treatment because it's a very difficult process to embrace one's HIV status. So we selected and trained peer navigators, and these are older adults themselves who also have HIV and who have been successful in in their care, in both receiving HIV care and in the care outcomes. And they were providing ongoing support to their beneficiaries. And we were also providing support and guidance to those peer navigators. And through that process, we built a community of practice where we thought that there were really important things and trends going on. And the analysis of this data is currently underway. So could I have the next slide, please? So we were taking as the sort of core element of our approach, motivational interviewing techniques. And we trained peer navigators in some of those basic techniques because these are quite successfully used for people with addiction. And we were trying to use them for a broader population of older people with HIV. So peer navigators were trained by a clinical psychologist who was providing them with guidance following the training. And there was also an HIV clinician on the team who could be approached for consultation about HIV questions. So this whole process was hybrid, just like this conference. People found that it was very important to be able to meet face-to-face and to be able to have some contact both for peer navigators who were a group and they were trained and then they came together for supervisory meetings about once a month to be in person together. But also sometimes they met with the beneficiaries in person. But a lot of activities were also done by phone and virtually. And that flexibility was very important during the crisis. Next slide, please. So these are some of the images from the work that we've been doing. And we found that the main point was that peer navigators felt that they were treated seriously, that their experiences and their being experts by experience was recognized and appreciated by the team, but also by us. And the capacity for each peer navigator was not that high, so they could take on about 5 to 7 older adults with HIV who were out of care because it's a heavy duty work to support them. So the intervention lasted 6 months and 7 months if we also look at recruitment. And over that period of time, the clinical psychologist provided regular supervision to the peer navigator group. And she was also available for consultation on any difficult cases. So the most important consultation that peer navigators approached for was how to draw boundaries between themselves and their clients, because the navigators were really taking on the burdens of their patients, and they found it was difficult for them to let go. Next slide, please. So the other project that we have ongoing is called PORADA, and it stands for Pursuing Optimal Results Over Aging via Decision Aid. So here our aim is to develop and to test the decision aid for older people with HIV that would help them decide whether or not to disclose their HIV status to other people, and to do so with meeting their unique goals. That means that whatever they decide, they will not regret later. And whatever they decide, they will not have stigmatizing reactions. So that is our goal for this study. Next slide, please. So here I will just give you a little flavor of what we found in terms of the disclosure of HIV status from our data across the 4 waves. So here we can see that the biggest change happened between wave 1 and wave 2. So that was during COVID. And at the time, there was a big jump in disclosures of HIV status. And that was, in our understanding, because of the lockdowns. So people had to disclose in some cases because there was no way not to, since they could be seen taking medication, or they needed help to access care, or they received their pills by mail. So there were many reasons for which disclosure had to happen, but not so much during the war. So that was not leading to any significantly, in the statistical sense, change. So also we can see here that men and people who lived alone had lower chance or lower probability of disclosing their HIV status. Anxiety and depressive symptoms also were quite important there. So they were people who did not disclose had higher symptoms of anxiety and depression. Next slide, please. So here it's actually I've already started mentioning that so men and people who lived alone had lower disclosure rates, and people who had the history of addiction had higher disclosure rates. And so that's in a way maybe a positive development if you look at it from the point of view of HIV prevention. So that means that perhaps the information about HIV and HIV literacy, and also maybe even the process of accepting one's HIV status, is more developed in this community of older people with HIV who also have comorbid addiction, just because they have been more exposed to services. Next slide, please. So what we also observed while we were working with older adults with HIV during the COVID-19 pandemic first, and then during the war, is that there is a lot of strain on HIV services during these times. And so the question becomes about the post-crisis scenario. What is going to happen? So can people who are working in this part of healthcare cope? Can their resilience be sustained long-term, or is there going to be some collapse simply because it's going to be too much and the burden will be too high? And then if this damage is done, then is the breakdown going to be temporary or reversible? So there can be some short-term effects and some long-term effects. And of course, the concern is what can happen to the overall care services. And we try to think of crises as opportunities for positive change so that things can be built better. And they can also showcase where there are current problems, but also where there are some ingenious solutions. So next slide, please. So in terms of implications for healthcare workers themselves, we see two key questions, and so they concern their safety and their own health risks. So what are the implications in terms of safety and health for healthcare workers in HIV care in Ukraine during the crisis? And are there safeguards in place to prevent those detrimental effects? And of course, the concern is whether the harms and benefits are equally distributed. So anecdotally, we have heard that a lot of clinics have lost junior staff because nursing staff either was internally displaced or became refugees. And then a lot of staff who were older, they stayed behind, just like HIV patients who are older, because of multiple jeopardies and a responsibility for care for older parents or older family members or vulnerable pets and things like that. So the risks to even safety of healthcare workers is not equally distributed because of their characteristics. Next slide, please. So this is a quote from one of our colleagues in Ukraine that highlights that the main unrecognized challenge right now is clinicians' own mental health. So a lot of people are traumatized, and pretty much everybody is. The question is to what extent. So clinicians are there all the time to help those people who are in need, but they need themselves to be recognized and supported. Next slide. And now I'm going to turn over to our colleague, Professor Altis, for some policy implications that he will highlight.
So really thrilled to be able to present this work on older adults with or at risk for HIV. And I think that there are a number of policy implications, and those policy implications really rely upon sort of thinking through the entire cascade from the point of diagnosis and disclosure, as Julia pointed out, but also, further down. And so one of the things to sort of think about are what are the sort of pathways that can be sort of more seamless with regard to getting older people with HIV through the system. There's a fair amount of data out there in terms of other kinds of studies that really present, as opportunities to reduce stigma. Things like rapid start antiretroviral therapy, irrespective of the population, but potentially for older patients with HIV who can, get into care quickly and to get the medications. Each and every time that you have an in-depth conversation with any patient, including older patients with HIV, it is an opportunity to reinforce stigma, but that has to be balanced, I think, with all of the special sort of social supports and other activities and the comorbid conditions that have to be addressed. And so one of the ways of maybe thinking about this is having sort of a low intensity strategy for getting them through the door and then increasing that as patients get through the door and get what they need, which is the antiretroviral therapy. So I think that that's going to be really important. I think that part of what will be necessary for that is to have these kinds of protocols and ways to interact with clients. I would say that there are a number of evidence-based practices that are available, some of which can be sort of taught and provided through other sorts of ways. I think especially where there is conflict, using sort of social media videos and those other sorts of things. There's always a trade-off, though, in older persons with HIV, because they might have some visual acuity issues and other kinds of things, or even some neurocognitive impairment. So you have to trade off the ways that you interact with them that is sort of aligned with where they are. And, I think that other things that are going to be really important is sort of thinking about things that are further down the HIV treatment cascade, especially things that are related to really the multiple comorbidities, being able to sort of think through issues around polypharmacy. Having interventions that check with folks. One of the sort of the major issues in the aging literature, irrespective of HIV, but even more so, are issues around social isolation and loneliness, and how do we sort of make sure that we engage older patients with HIV in a way that is sort of meaningful to them. Having them in a system, for instance, one of the ideas is integrating patients with HIV into primary care services. And we recently have data that we've published looking at how both patients perceive decreased stigma by moving from a specialty care setting into a primary care setting, and also the way that providers think about key populations. And so I think that that will be a really important sort of next generation of activities that are going to be important from a policy implications. It also allows patients to be able to get treatment closer to their home. Part of what will have to happen with this is really making sure that there is adequate sort of guidance through national guidelines that sort of carve out special populations, including older patients with HIV, and then sort of thinking about how to take that guidance that's present nationally and sort of make sure it is diffused out into the local networks who are providing these services, whether it's clinicians, whether it's outreach workers or other folks in the field through NGOs, for example. I think that the other thing that's going to be important is that conflicts like the COVID pandemic, the war currently, or even as natural disasters, we're, at least in the US today, we're having the hottest 3 days in over 100 years. And these are the kinds of things that are inevitably upon us, but really having some preparedness to be able to deal with these sorts of things, especially with workforces. I think the last slide from Irina on, the stress upon our healthcare infrastructure is one of those factors, and how can we sort of re-implement and do things differently When there is such stress, how can we use things like artificial intelligence to create educational training for folks, et cetera, so that we can sort of reduce the stressors that are on those who are providing care, being able to move loneliness interventions into, the virtual space of cell phones, et cetera, and figuring out when to upregulate that to, the individuals. I think that, we have to sort of re-envision the way that we do things. There's not an absolute evidence basis for how to do all of the work that we would like to do with older patients with HIV. I think that we have to do it smartly. We have to understand what's getting in the way of some of the barriers. We have got to sort of engage the customer, and we have got to work with coalitions of stakeholders, whether it's NGOs, governmental and other healthcare organizations, in order to streamline the services so that older patients with HIV and others most at risk will be able to sort of survive within the healthcare system. And I think that that's going to require sort of a re-engineering of the way that we do things. I think that these protocols that we've often developed, I think in good faith, to provide patients for care is a bit nuanced. And I think that they are general guidelines, but the way that we enact them for key populations like older patients with HIV and revisit them over time, I think will be really important. So I will end there, and Julia, Sheila, and myself will be available for any questions if there's an opportunity.
Svetlana, will there be time for questions now?
Thank you so much, Dr. Sheila Shenoy, Dr. Юлія Розанова, доктор Рік Алтіс. Я тільки єдине хотіла би сказати, що...
The only thing that I would like to emphasize is that immediate cooperation of REACH-95 with such a significant, large academic institution, university, Yale University, that's so important for us, because again, we reconfirm that it is so important to implement evidence-based approaches and implementation of optimal approaches to provide medical care for older people who live with HIV and in the context of the war who encounter various issues as reported by our colleagues, depression, anxiety, mental health issues. All of that is going to be relevant, and not only for older people who live with HIV. But what was important for me to hear was that the Ukraine's experience in overcoming those issues, detecting HIV among older people and managing those cases among older people, that will be an opportunity to include into global approaches and global strategies the experience of our country. That unfortunately, that was not our wish that we have accumulated this experience, but nevertheless, it would be, of course, good if we could implement our project further on in the peaceful context with peaceful Ukraine, so that really that work developed after the war is over. And our colleagues from Yale University stay online, and they can answer questions from our audience now, I guess. So any questions to our Yale University colleagues? And let me welcome colleagues Sheila, Yulia, and Rick, because their experience of working with Ukraine, with NGOs, international organizations that implement the HIV programs in Ukraine. They have many years of experience. I understand that it started somewhere in 2014, that Yale University started implementing various programs and initiatives with us. Any questions again? Okay, the audience has no questions so far. So thank you. Thank you for this opportunity to contact us from the US online. Thank you, and let's keep working together.
Дякуємо. Ну, колеги.
Thank you. And now, colleagues, we still have not done one thing. What is that? Can you guess? I have not yet introduced another key partner in the framework of Consortium Reach 95. So that's another surprise, because now this is our colleagues and partners who go to the scene. This is the team of NGO Public Movement Face Hope Love, led by, well, please change the subtitle. So the entire team present today at the inauguration conference, a team of Public Movement Face Hope Love. We ask the team to the scene. Please come here. Tatiana, please come here and take your seat. Colleagues, thank you. Please come, dear colleagues. You see the cohort on the scene. We'll be ready to take a photo now, I guess. Please take a photo. You see, that's a large team. That's a big family now. By the way, this is not the full family, but most of them are here.
Дякуємо. Я хочу, не розходьтеся, будь ласка. Я хочу пані
Tatiana Semikop, I would like to pass the floor to you to welcome our audience and to introduce the large team, our dear partners implementing Reach 95 project. Just a couple of words. You can see how powerful this team is. These are social consultants with a lot of experience working in the field of HIV/AIDS, and our organization, we've been working in this field since 1996. That is why I believe, and I'm sure, that these experts, that they will be the best support for the healthcare professionals in those facilities where Reach 95 is working. So I wish us all efficient and productive work. Thank you. PAS, international organization, has long been aspiring to work with the first HIV service organization that was set up in Ukraine, in the city of Odessa. And this NGO, their name is very significant to us. This is Face Hope Love. This is very touching. These three words, they're so important for every individual. Faith, hope, and love. This is what makes us resilient. So we are very happy to work with this organization, who, on the competitive basis, involved consultants in each of our regions of the implementation project region. So you see the large cohort of coordinators of social work and employees of the organization in the city of Odessa. Thank you. And now I ask you to take your seats, but one of your representatives, one representative of public movement Faith, Hope, Love is going to stay here. That's going to be Lilia Leonidova. She is Project Advocacy Officer of Reach 95 project. And now we will hear more about the experience of cooperation and the role of MP and councillor commissions in advocacy and providing for the resilience of gender-sensitive, gender-oriented, and human rights-based HIV services. Your experience is so incredible, so you're welcome.
Доброго дня, доброго вечора. Я вдячна кожному і кожній, хто залишився, хто дочекався. Я розумію, що всі вже заморилися, але я вважаю, що ця тема, яку я зараз буду висвітлювати, вона вкрай важлива. І це, на мій погляд, я аналізувала і інтернет-мережі, це дійсно інноваційний підхід у впровадженні послуг. І чому, знаєте, мені здавалося, що як ця тема може бути причетна до тих питань, які ми сьогодні обговорювали. І 1,5 чи 2 роки тому, коли ми обговорювали з громадським рухом «Віра, Надія, Любов» і з Світланою Леонтьєвою, і я розказувала про досвід, бо я є депутаткою Одеської міської ради, я є голова постійної комісії з соціальних питань, і я є радниця мера з гендерних питань, тому ми обговорювали, як працює Одеса. Звісно, я буду говорити на досвід.
We discussed how we work in Odessa because we have been working there for quite a long time. And I explained how it should work in all Ukrainian regions. And we concluded, we summarized with the conclusions that we have to advocate the issue on cooperation between the civil society, international partners with deputies commissions, those who take decisions in Odessa City Council and other councils. So let's start. So, as Svetlana mentioned, I'm going to tell you about the experience of cooperation and role of Deputy Commission in advocacy of resilience, sustainability of gender-oriented, based on human rights approaches. So, just briefly, I will tell you on this tell you about the stakeholders based on our Odessa experience, on the functions of Deputy Commission, on advocative campaigns which are currently provided by civil society, on cooperation and with the NGOs, and I will provide examples of successes. Why it is important? We have had a lot today about the situation both before the war, during the COVID epidemics, and during the full-scale Russian invasion, and we realize that every year we face more and more challenges, and so it is possible when we communicate and when we convey in an emotional way what should be done. I decided to analyze all the stakeholders of decision-making process. I'm talking about all types of decisions about the target populations we are talking today. These are departments of local councils, its healthcare facilities, its social service offices, its NGOs, international partners, deputies, deputy commissions, coordination councils, and inter-regional groups. We can add here the inter-district working groups in big cities, also territorial communities, etc. So ways of funding, and here I recall the whole process. I became the deputy in 2015. So we have here the head of healthcare department of Odessa region. You may correct me. At that time, there was a decision to adopt a special targeted HIV/AIDS program. Honestly, it was a challenge because stigma was there in place, and it is still here. And I remember the efforts of the civil society to advocate that program. And I remember how many times the program was adopted by the city council, but eventually it was adopted and it was given impetus for further activities, and it was the program was operational till 2024. It included public awareness, and it got strong financial support both from international partners and Odessa Council. It included procurement tests, training doctors, awareness of civil society, establishing of offices of trust, and cooperation with primary healthcare facilities. I am not going to list all of the issues mentioned at that time. Why? It stopped in 2024. We realized that during the war, that a significant share of local budgets are used for supporting territorial protection units and also IDPs and also the victims of sexual abuse during military conflict. Unfortunately, the occupants brought this concept in our reality. Odessa region received a lot of people from occupied Kherson and Mykolaiv region, and this is one of the key populations we work with, and they do need support in parallel with other populations. So the decision was taken to include this program to a bigger city program called public health. I'm not saying it is good or bad. This is also a form that allows working to use innovative approaches. Currently, we are fighting papilloma and prophylaxis of breast cancer, and we included the key points of AIDS HIV program to the city health program, and we allocate money for that as well. As a positive example, I would like to say just recently there is still a problem with supplying tests. We are all aware what was happened in Odessa. Our hospital always didn't have tests even a single day, and it is due to prompt response of the city council and deputy and civil organization as well. So we do not mention social services, but it is also one of the instruments we also use. But social service is allocation of funds from local budgets to NGOs to provide these services that cannot be provided by the healthcare department or the healthcare unit of local community. So yes, we do use social services, and unfortunately, we don't use this mechanism 100%, and we have to improve the situation. And I'm going to provide to you an example about our recent decision. So, and I think we should work on this, both also in HIV services. So, cooperation with the international organization and NGOs. What are the functions of deputy commissions? Include strategic planning, development of programs jointly with the key line departments. In our case, it's healthcare department, then advocation. Just shortly, just keep on persuading, keep on pushing the deputies of mayor why it is needed, and just do your job. Decision making, yes, it is the commission that decides whether to bring the issue into agenda or not. And every item is procurement of tests, procurement of equipment, and other issues are first discussed by deputy commissions. Then funding and control and monitoring are their responsibilities. Supporting by deputy commissions are key for sustainability of services, since they would ensure long-term political and financial support. I don't like the expression political will, but unfortunately that is the reality, and political will, like financial support, they exist, and we have to deal with that, to cope with that somehow. Challenges. It's not always that deputy realize very narrow targeted issue. Today, just recently, I learned a lot of new terms, terminology, but I realized that it is crucially important to convey the challenges and problems we face now during the war. So we were talking with Tatiana. So we should be ready for any kind of epidemics, and we should work. We should inform the deputies, set the funding, all issues related to HIV/AIDS are really crucial and should be on the agenda. Now, quite often, any issue which is currently discussed in the commission, all the deputies are invited for the discussion, whether it is environment or finance or whatever. All the deputies come to this session to know what is it about, because not medical terminology is not always clear for everybody, and it is this approach is efficient. Our management, the people from healthcare department or healthcare facilities, if it is infectious related issue, infectious doctors will come, and that is advocation. And also I mentioned that program are approved not from the first reading. That's why we introduced these hearings or discussion together with NGOs, cooperation with NGOs. Here I can tell you a lot of things, because NGOs, as Ms. Sharon Bay said, that it is the civil society who gives us push or impetus. And it is sometimes it's so strong that, civil society has much more information. They get it often quite in a quick manner because they keep close contacts with the clients, especially in view of situations that some Ukrainian territories are occupied. Also, bureaucracy is our reality. Yes. Yeah, okay. Flexibility. Yes. It's clear that we should cooperate with the civil society and give them green light. So examples of successful cooperation. At our list intersectoral session, the NGOs raised 3 issues. The first one is for HIV positive women who are given who are pregnant. They need medicines that stop lactation. They are expensive. We requested for the data. We got the statistics, and it was a decision to procure these specific medicines because we understand the consequences. Then, second point, unfortunately, the palliative HIV patients that are staying at home, and we understand that we have the lack of social workers. So we allocated funding for social workers from the NGOs to provide help and support to these palliative HIV patients. So we take this decision, allocated funding, etc. And so this is the way how we manage to successful and promptly find the solution. Then challenges: stigmatization, discrimination, finances, and challenges of equal access to services for all groups of population. So, summary. I believe that it is crucial to cooperate with all sectors for sustainable of not only health sector at HIV people, but that is the practice which should be actively used. And I would appreciate you sharing your experience, your practices in other regions. And from October, I will help to advocate your services with the deputy commissions. So thank you for your attention. Hopefully I was brief. Thank you, Ms. Lilia. I just also wanted to reiterate that the experience of NGO Faith, Hope, Love. Love is also cooperation with them is envisaged in the second year of our activities. So we have 15 regions under the project, and we will implement your experience of cooperation with the deputy commissions, because allocation of local funding is important, and also supporting such programs with the funds from the national budgets, because the funding of donors would not be enough if local governments would not be financially engaged in supporting such programs. And I think that From now, deputy commissioners would be aware what is 95, 95, 95. Thank you, dear colleagues. Thank you for your applause. Our agenda is over. Just to inform you that tomorrow we are starting the second day of our scientific and practical conference on launching Reach 95 projects, but we will start working in two groups. In this hall at 9:30, we will have the live broadcasting on 9:30. We'll have the first subgroup, which will, and online participants will be able to see what is going on, and they will discuss providing HIV services in our healthcare facilities. We will discuss approaches to implementing project activities. We will discuss pre-contact prophylaxis and approaches to testing. We will discuss the decentralization issues and present our first successes in cooperation with the public healthcare facilities. In parallel, from 9:30 to 11:30, we will have this second group, and it will be on organization of monitoring and assessment in project activities on the HIV identification in public health centers. So you will go, please find the next door in the street, and you on the second floor there you will have the second meeting of the second group. So we will have two subgroups working 9:30 to 11:30 here and the next door from the street. Then we are going to have coffee break 11:30 to 12, and then we'll be back at 12. And we invite Irina Demchenko, and we will invite Irina Demchenko to present the just very hot result on the study of living people with HIV stigma index 2.1 survey in Ukraine. Main results of this survey's fifth way in 2023-2024. And then me, Svetlana Leontieva, I will inform you on Reach 95 next steps. That is our agenda for tomorrow. And I would kindly ask Natalia Litvinenko. She is the director of the National TB Hub, our long-term partner in developing this training center. Ms. Natalia has some information for you and those who participate in this conference online and those who are present here in this hall. Over to you, Natalia.
Добрий день, але напевно вже добрий вечір, шановні колеги. Я всіх вітаю.
I'm happy to welcome you all, and I believe that you've now witnessed the first day of the conference. It is such an interesting event, and I believe that above all it is helpful for you, for your communication, for exchange of experience, for discussion of some issues and questions, and to determine plans for the future. However, apart from that, you will do that all, you will get that all, and you will come back home with presents from the project. You could see that in your shoppers' bags. There are some sparkle, small gifts, presents. I will not tell you what that is. If you have not yet opened your
folders, your bags, but we will also provide the present as the National Training Center for Professional Development of Medical Workers. We also will offer a present to you, and that's certificates, 20 credits for continuous professional development. But there are certain conditions. To receive this certificate, you need to work just a little bit. Tell me, those who are in the audience, the participants in the audience, please raise your hand if you have registered. Okay, that's a lot. Great. And now raise your hand if you have not registered. That's just one. This is representative of PAS International Organization. Okay. It doesn't matter. Everyone will get the certificates. Certificates will be received by the healthcare professionals and doctors and nurses and specialists with non-medical education who work in medicine. There will be several types of certificates, so all of you will get those. Regarding nurses, now in the testing center of the Ministry of Health, we are changing the conditions a little bit. Previously, the nurses did not receive certificates with the credits, but now even nurses need to undergo testing and receive credits. We issue certificates. So far, we have not yet decided how many points will be provided. We indicate the certificates with where the credits are not indicated, but after the testing center decides on how many points are going to be credited, because all of that is registered online, so no one will be lost there. And then we will add this the credits, and we will issue the certificates for nurses. All of them, all of you will get that. So that's one thing, mandatory registration. Then you will also need to undergo the testing. It will be open from 12:30. And please, if you are in the audience, please charge your phones so that you had some device to undertake the training. So it will last till 6 p.m. So it's important because after 6, we will close this opportunity to undergo the testing. And also for those who are online with us, keep in mind that that's the limit, and these are requirements of the MOH testing center. Because previously it was possible to write tests for a day or two after the conference. Now it's only during the conference that it's possible to do that. And again, I welcome and congratulate everyone. And Svetlana reminds me about 70%, but that has been mentioned already repeatedly. So those who are online can see the chat, I hope, and you here in the audience, you can enter the broadcast. So that's 70%, 7 correct answers should be there. And also an organizational aspect for those who are online, you can see this large red button that you need to press to undergo the test. It's green or red, frankly speaking, I don't remember, but it's very visible. And for those who are now here in the audience, for you to receive the certificates, in the same way you need to go to your mail, and there you have a reference, a link to your broadcast. You need to enter and to click the link and enter the broadcast, just as the colleagues who are now watching the conference online. You need to find this same button, and on your smartphone, laptop, on any device, you can do that. But keep in mind that there is this limit, 12:30 till 6 p.m. If it doesn't work for you, if you have any questions, We are in touch. We have our administrator of the platform. She's going to work tomorrow as well. Anastasia Lefet, I don't see her now though. But anyway, if you have any issues, approach organizers. They know how to do that. Ask them. We will help everyone. We would like everyone to get what you need. Okay, then good luck. All the best. And towards the victory. Okay, this is very timely, and we are going to stop the broadcast. But before we do that, let me express gratitude to everyone here in the audience, to all the partners, colleagues, and friends who have joined us online, who have registered to participate in the conference. I wish you all to resilience, and thank you for your adherence to the work that you do on the daily basis. Thank you for this day that we spent together. And this is the end of the broadcast on YouTube. Please confirm that we've closed it.